Good morning, everyone. Thank you so much for joining us today. I'm Dr. Stephanie Black. I am the Director of Continuing Education for the Ontario Shelter Medicine Association. Before we get started, we have Dr. Linda Jacobson, the President of the Ontario Shelter Medicine Association, here to talk about what the OSMA is and what we do. Thank you so much. Welcome, Linda.
Thank you. The whole is always greater than the sum of its parts. When we communicate with one another, learn together, and work with one another, we can do so much more, and we can do it so much better. As a networking group, the OSMA has succeeded beyond our expectations. So many of us know each other now, can ask each other for help, and can communicate constructively with one another. We're also now part of a network that includes other parts of Canada and other parts of the world. We're a small organization with impact far beyond our size. We made a conscious decision from the start to be as inclusive as possible. And for that reason, nearly all of the content on our website is open to all, and our blogs go out to anyone who is interested in them. The more members we have and the more funds we can generate, the more we will be able to do. For those non-members who are here today and who qualify to be members, I invite and strongly encourage you to join using the link provided. Membership is open to veterinarians, registered veterinary technicians, and non-registered technicians. For those who support the work we do but can't or don't want to join, please donate whatever you can. I'd like to remind our audience that OSMA membership is not just for those who work in shelters. It's open to any vets or techs who provide related services or just want to learn more. In closing, thank you so much for being here today to learn more about accessible veterinary care, keeping pets and families together, and how the animal sheltering movement can continue to build truly humane communities. These are difficult times, and we've all had our share of those difficulties at various levels and intensities. I'm so proud to be part of a sector whose central goal is to help the vulnerable, make the world a better place, and be hopeful and constructive, no matter what may face us. Thank you so much for being here.
Thank you, Linda. So before we get started again, I'd like to thank our generous sponsors. Today would not be possible without them. So thank you so much to VCA Animal Hospitals, Hills Food, they have a food, shelter, and love program, Vet Purchasing, Benson Medical, Ogena Solutions, and Ontario Veterinary College's OVC Pet Trust. Today we have Emily Mossman from OVC Pet Trust to tell us a little bit more about OVC Pet Trust. Welcome, Emily.
Thank you so much, Steph. I just want to make sure I unmute myself because I can't tell you how many times that happens.
You're all set.
I am so happy to be here this morning with all of you. I think the OSMA is such an incredible organization. Linda, I love how you speak about it and with such passion. That's so lovely to hear. I want to thank Linda and Steph for having us today. We are so proud to be back supporting the Ontario Shelter Medicine Association CPD Day with this year's theme, Thinking Out of the Shelter, Taking Animal Care into the Community. My name is Emily Mossman, and I'm the new Outreach Coordinator for OVC Pet Trust. It's so nice to be here this morning with all of you. Before I talk to you about Pet Trust, I just want to take a moment to acknowledge how hard this year has been for all of us, but especially those in the veterinary and animal care community. You have had to change the way you offer care to your clients and their pets, and this has not been easy. We know that those who care for animals are very special people who want to be there for animals and their people in some of their toughest moments. While the way you offer compassion and care has had to change, the level of both has never wavered. On behalf of Pet Trust, I want to thank all of you for continuing this work amidst the challenges you're facing. We are so grateful to you. Now, some of you may be familiar with Pet Trust, whether through our Pet Memorial program as a supporter, or through Dr. Shane Bateman, who is a Pet Trust funded veterinary criticalist here today, and who's always been incredibly supportive of our work. For those who aren't as familiar with Pet Trust, I'll just give you a little bit of background about how we got started. We are Canada's first charitable fund dedicated entirely to advancing the health and well-being of companion animals. Since 1986, we have raised more than $35 million and funded more than 600 studies focused on companion animal health. Along with innovative studies, OVC Pet Trust continues to fund education and healthcare to benefit the animal patients at the Ontario Veterinary College. Patients like Sully, a small white West Highland Terrier who was treated for bladder cancer at the OVC Animal Cancer Centre. Thanks to the team at the OVC and support from Pet Trust, Sully enjoyed 4 extra years of good quality life. His family remains truly grateful for the 4 years they got with their Sully. We could not do what we do without the support we receive from the veterinary and animal care community. Your support is invaluable to us and truly makes a difference to the advancement of veterinary medicine. I invite you to take a look through our Best Friends magazine, which can be found on our website, and I believe Steph has the link that she can share. The stories shared in these pages talk about the innovative and life-changing discoveries funded by OVC Pet Trust that have helped many beloved pets live longer, healthier lives. This magazine is available for order, and we have a brand new issue coming out this month. If you are interested in ordering copies, please let me know. Ordering our magazine to share with your clients or adopters is just one way you can support the work of OVC Pet Trust. The most common way to get involved with Pet Trust is through our Pet Memorial program. This is a way to honor the death of a beloved pet by making a small donation to Pet Trust in their memory. Pet Trust then sends a letter to the owner, letting them know of the donation and expressing our sympathy and yours, and how this donation will help advance companion animal health care. In our last issue of Best Friends, you can check out page 27 to hear directly from Donna and Peter, loving owners of their recently passed Black Lab Dollwood, about how much the Pet Memorial letter they received from their vet meant to them. This morning, I'm especially happy to share some of the resources that we offer to assist you in advising, educating, and supporting your clients and adopters. Informed by the work and feedback of OVC experts, the Pet Loss Support Guides, which are preparing for the loss of a pet, coping with the loss of a pet, and helping children with the loss of a pet, are written to assist your clients and adopters facing some of the most difficult moments of the human-animal bond. These low-cost resources are available to order through veterinary purchasing or by emailing our office at ovcpet@uoguelph.ca. If you are interested in learning more about our resources, what's going on at the Ontario Veterinary College, the studies we fund, or how you can get more involved, please email us at ovcpet@uoguelph.ca. We would love to hear from you. Thank you so much, and I hope everyone has an incredible time today.
Thank you so much. So our first speaker is Amanda Arrington, and let me just make sure she's with us. Perfect. So Amanda, you're free to go ahead and start sharing your screen and get your presentation up whenever you're ready. So Amanda Arrington is the Senior Director of the groundbreaking Pets for Life program at the Humane Society of the United States. She previously served as a lobbyist and North Carolina Director for HSUS. With Pets for Life, Amanda guides a social justice-driven approach to create equity in and access to pet resources and information for people in underserved communities. Under her leadership, the program has been implemented in over 50 markets across the country and is working to make companion animal welfare a more just and inclusive movement. Please join me in welcoming Amanda Arrington.
Good morning, everybody. I'm going to ask it one time at the beginning. You can see and hear me okay?
Yes, we are good to go.
All right, wonderful. Well, good morning, Canadian friends from the United States. I hope that you all had a good week. Not much is happening at all down here. Been very quiet, non-eventful, but happy to be with you this morning. And I think, Stephanie, you and I had talked a little bit about this, that I welcome questions as we go. So if people have comments or there are thoughts or things that you would like for me to discuss a bit more in depth, please join in and enter that into the chat as we're talking along. I don't think that people are able to unmute and ask questions, but I really do welcome that. I don't see it as interruptions. I think that it makes our time worthwhile together, so we don't have to wait until the end for there to be any points of discussion or any questions asked. And if they are put into the chat, Stephanie, will you be helping monitor that?
Yes, absolutely. I'll ask them on their behalf. Thank you.
Okay, thank you. And again, please don't feel like you're interrupting me at all. Just let me know if there's things that come in. So as Stephanie said, I am the Senior Director of the Pets for Life program, which is part of the Humane Society of the United States. And Pets for Life really works hard to increase equity and access to pet resources for people who are living in underserved communities. Our team is working really hard every day to evolve the field of companion animal welfare to make it more community minded and to be a comprehensive resource for all people and pets in the community. And we're focused on creating a philosophical shift in the movement as well, looking at larger issues of racial and economic injustice, and then how can we start to address ways that we've been complicit in, or even perhaps directly contributed to systems of oppression and discrimination. And then how do we start to disrupt and dismantle those systems through animal welfare work? So the program has been implemented in over 50 communities across the United States so far. And in each location, we identify and then we focus on the most underserved areas in those communities. So those are the areas with the highest rates of poverty and the least access to pet resources. We work from a community outreach model that builds trust and relationships with people and partners within the community. And so we're in all types of communities across the US. We're in urban centers, we are in extremely rural areas, we're on native land, we're in all regions of the United States, and we also partner with various types of organizations, from open admission shelters to limited admission shelters, organizations that don't have sheltering under their purview at all, so high volume spay-neuter clinics, community medicine clinics, and then even directly with Native agencies. And we've done that specifically and deliberately because we want to show that a human-centric approach to companion animal welfare can work no matter the size or demographics of your community. And so having that diversity in implementation has been really important for us to collect data from, and then to show again that this can work no matter your organization or where you're operating. And so I want to share just a few pieces of data so you have some context as I talk about what it represents from the PFL work. So to date, we've served over 215,000 pets. And within that, we've provided over 135,000 spay-neuter surgeries at no cost to the pet owner. And because we're not just a spay-neuter program, we really want to be that comprehensive resource of whatever it is that people want and need for their pet and don't have access to, that we can bridge that divide. And so to that end, we've provided over 625,000 medication services supplies. So this is anything from flea and tick medication and dewormer to leashes, collars, litter boxes, services around housing issues with pet fees, deposits, landlord interventions, return to owner fees to reunite families. So again, really anything that someone could come into contact with or a way that can engage within the system around their pet. And so we collect the same data in all of those locations where we operate, and the same data from every person and pet that we meet. And I want to share a few of those with you as well. I know that there are likely differences between the United States and Canada, but I think in low-income communities in particular that there are probably similarities as well. And so when we look at the work that we've done of all of those pets that we've served, at the time of meeting them, about 88% were not spayed or neutered. And that's a pretty high number just generally, but when we know for the United States overall that about 90% of owned dogs and cats are spayed or neutered, it really shines a light on just how Conversely, true that is in underserved communities. And so this is where we need to be putting a lot of our time and energy and resources into providing services for people and their pets. And then of particular interest as well, because again, we're not just a spay neuter program, is that about 70% of the pets have never seen a veterinarian for anything. So that's not just for being altered, but no vaccinations, no preventative care, no wellness care, and a huge audience of pet owners who just don't have a relationship with the veterinarian. And then a final statistic that we think is very important for us as service providers is that of this pet owning audience, almost 80% have never reached out to their local shelter or animal services agency. So again, it really has illuminated that there is this group of pet owners that we have not done the best job of connecting with, and that we have a huge opportunity to build relationships and trust with that community of pet owners. And so a major lesson that we've learned through PFL is how companion animal work necessitates a consideration of the human condition. It's extremely important for us to have context in our work of those larger systems and structures that we're a part of as a movement. And therefore it impacts our work. And we've done a lot of great things in animal welfare over the last few decades. We've made huge strides. We've brought animals into very sharp focus, as this picture shows. That dog or cat we see very, very clearly. But what we believe is that now we need to bring the entire picture into focus. And that doesn't mean making the animal less seen or sending that animal into the background. We'll keep as sharp a focus on that animal as ever. But it means growing awareness of the person who is connected to that pet, of the environment that that pet is a part of, the community that pet lives in. And that when we do that, when we have a better understanding of that full picture, that we're going to be more successful in our work, and we're actually going to do our work more effectively, which is to provide a healthy, happy life for all animals. There are, unfortunately, racial and economic inequities in every facet of our society, and those inequities impact people and therefore their pets. And we don't have a lot of time to get into tons of details, but there are a few areas that I did want to touch on today that I hope encourages conversation and more exploration after this presentation. And I normally provide this information specific to the United States and the history of discrimination and oppression in our country and issues of racial and economic injustice. And so I don't have as much familiarity, I will give that disclaimer, and knowledge of Canada. But again, I know that there are distinct differences between the two. But I do think that there are some real challenges and disparities in Canada that are important to recognize and to understand. And I want to thank Dr. Jacobson and Faustine, who helped me research and put together some of this data specific to Canada. So socioeconomics plays a significant role in the level of access that people have to resources for their pets. And in Canada, there are about 5 million people who are living in poverty. And while maybe not as connected to race and ethnicity as in the US, poverty in Canada is still unevenly distributed, as you can see here, that poverty disproportionately impacts racialized Canadians more so than non-racialized. And here is just a little bit of a different sort of look at that, of looking at the rate of poverty in children across major Canadian cities. So obviously the rate of poverty for children is correlated to poverty in households. And so you can see here, if you want to just take a scan, I believe that there are people from all over Canada who are joining, and so to find kind of the major city center that would apply maybe to your work, but this kind of gives you an idea of the way that poverty is spread out as well, with Toronto having the highest rate of poverty in children at close to 27%. And I haven't seen, and maybe you all have this information of what the top reasons are that people surrender pets to shelters in Canada. In the US, pretty consistently, there are two reasons. One is the inability to provide and afford veterinary care, and the second is for housing insecurity, so issues around housing. And from the information being able to collect here, I would guess that's probably towards the top of the list for people in Canada as well. So what this graph is showing you is some of the struggles with affordable housing, or the lack of affordable housing in Canada. There are about 3 million Canadian households that are what's called precariously housed. And so that means living in one of these three conditions that you see here, that housing is unaffordable. And that means that someone is spending more than 30% of their income on housing alone, or that housing is below standards, that it is unsuitable, or that there's overcrowded housing conditions, and so it's inadequate. So you can see again here for some of the major cities in Canada, that dark blue category, that's the percent of households that are rent burdened, that are cost burdened on what they pay. So more than 30% on housing. And then the light blue, that's unsuitable housing. And then the green is the inadequate or overcrowding housing. And so all of these housing conditions, as you can imagine, would have major consequences on families with pets, not only probably in housing that people can find, but then the stability and the security of housing. And so families with pets can be very directly impacted by that. And again, I'm not as familiar with, but I don't know sort of the economic fallout that's happening around the pandemic, but in the United States, we had an affordable housing crisis before COVID, where there was not a state in the country that had sufficient and available affordable housing for low income people. And that didn't even get into pet friendly. And right now we are really sort of teetering on the edge of a huge eviction crisis in our country, with eviction moratoriums expiring that were put in place because of the economic devastation of COVID. And so we're really paying close attention to housing issues in the States and how that's going to impact shelters and how it's going to impact people and their pets. And so I wanted to share this with you all today, because I think it's significant enough of an issue just with this information to see that it probably has some real consequence for animal welfare work. It's also important for us in animal welfare to recognize the differences that in experience and in engagement that communities have with law enforcement, and the differences between white and non-white communities. We know that we're not exempt from this in animal welfare, and I think that that's one of the big takeaways for us in Pets for Life, that there is this enforcement component to animal welfare. And so if there are these disparities across criminal legal systems, that likely then also is true within our own work.
Sorry, Amanda, can I just interrupt for a second?
Absolutely.
Someone was asking if you could define racialized for us.
So Canada has some very complex definitions. So there might be someone on this call that can speak to it a bit better than me. But essentially it's non-white people. So people who would self-identify in some other way than white. And so whether that is Black, Indigenous, as you can see sort of the categories here, or Latino, Latina, a variety of different. So essentially racialized in Canada is anyone identifying as non-white. Does that help? And did I do a good enough job? If anybody has a better definition, please share.
I think that's great. Thank you.
Okay. And so what we're looking at here was a study that was done just in Ontario specifically, that looked at the incidence of racial profiling for people that participated in the survey. And so you can see a much higher rate of people who are in non-white categories experience some form of racial profiling. And again, that's important for us to know, because this can very much seep into and be a part of the work that we do in animal welfare. But it's also important just because we need to understand the way in which various communities can view us as service providers, can view what might be deemed as authority, and then how we're able to build trust and relationships within different communities, and just the significance of having that perspective from the community. And so we want to look within our own field and our own enforcement and policy making, but we should seek to understand, again, sort of that potential distrust of the larger system, and what that means for our work. And this is just a bit more information, sort of within that same conversation, that if there is discrimination and discrepancies in enforcement, then that likely means the outcome is going to be what you see here, that Black Canadians make up 3% of the country, but account for about 10% of your incarcerated population. And then very similarly, Indigenous people account for about 5% of the Canadian population, but represent about 27% of the prison population. And that again is quite parallel to what we see in the US, that our minority communities have a much larger rate of incarceration. And so there's a lot of imbalance within that system. And then just sort of what that means and how it destabilizes entire communities. And so again, something for us to start to sort of take stock of and understand a bit more in the way that it impacts people and their pets. And then I was able to pull a couple of different pieces of information around COVID, and because we're all still reeling with, and sort of dealing within this new normal of the pandemic, I thought it would be helpful to share again how there are disparities. So this information is just for Toronto, and looking at data, it seemed like there wasn't as much consistency across the country in collecting COVID-19 information by race and by income, that some places were doing that better and more consistently than others. And so the one area that had some pretty decent data to report out on was in Toronto. And so what this is showing you, to break it down, is kind of the rate of COVID cases compared to the size of the population by income. So essentially, the lower income a person is, the higher the rate of COVID cases within that community as compared to the population. So just to kind of give you an idea, so people making $30,000 a year or below represent about 14% of Toronto, but represent about 26% of the COVID cases. And then on the opposite end, people with an income of 150,000 or more represent 21% of the Toronto population and only represent about 7% of the cases. So showing that there are some real disparities in cases by income. And then sort of similarly around racialized populations. And so the non-white community represents a smaller share of the population, but a higher share of the cases. So probably not a surprise to any of you. I think it's been covered, pretty well in the news, and it's what we're seeing here in the US, that COVID is definitely hitting certain communities harder. Low-income communities and non-white communities are bearing the brunt of this pandemic more. And so I thought I would stop there for just a second. I'll go back there and just see if there are any thoughts or comments on this data. Again, it's not a full take on everything, but I wanted to just highlight a few areas that we don't always think through, or we're not always applying to our animal welfare work, because it really is about people. But then, sort of having that time to consider what happens for people, therefore impacts their pets.
It doesn't look like anyone has posted any questions to either the Q&A or the chat window. Oh, somebody just did as we're speaking here. So is there any data available that looks at gender?
In what way?
Lori, would you mind explaining a little more detail about what you're looking for? You can put it in the chat window.
I will say, as you're putting it in there, that there are a handful of great organizations that have a plethora of data in Canada, and one is and I have it as a source on one of these, is the Canadian Poverty Institute, I think is the name. And in looking at their data, they talk a lot about gender inequity in Canada around income, and how the disparities in income and wealth are the greatest for racialized women. So in that regard, if that's kind of what the question was, there is a lot of useful information on that.
Okay, and it looks like Michaud has a question as well. I'm just asking you to unmute. You should be able to unmute yourself now, just temporarily. You had your hand raised.
Yeah, don't be shy.
So Michaud Audrey, did you want to unmute yourself so you can ask your question? Oh, you just lowered your hand. Okay, I guess we changed our mind. All right.
It's early in the morning, hit the wrong button.
Yeah. Okay, so Lori has added to her question, are there gender differences regardless of where a person identifies on the spectrum?
I guess I'm still not clear on the question. Are the gender differences in what way? And I guess maybe the answer would be that there's probably data that would break down whatever the questions are, whatever the categories of interest are by gender. From what I've seen, Canada has a robust set of data from the census and from different organizations doing that collection. I, again, am not an expert on this information in Canada. I'm definitely not even in the US, but I've been speaking to it and working through it and researching it for years in the United States. So I'm a bit more fluent in it. And so for Canada, I would refer you, and I can provide at the end some links to the sources that we utilize that seem to have, again, just a great amount of information that I would encourage everybody to explore more, because obviously just within an hour, even if we wanted to, we wouldn't be able to talk through all of the different areas. So I'm sorry that I'm not answering your specific question.
She did say, are the inequities also being looked at based on the above? So I'm not sure if that helps.
If you're asking if their inequities are looked at based on gender, absolutely. Like I said, the sites that seem to have the most robust set of data really do break down information by gender as well. I saw a ton of detail around that.
Perfect, thank you.
Okay, so with this information that has been shared and sort of what we're talking about, I wanted to kind of discuss next, with inequities, knowing that there is institutional discrimination, that there are these inequities that exist in all of our systems. What can we do then, and what works in starting to not only recognize and address those inequities, but hopefully start to shrink them, start to mitigate them? And I think that in animal welfare, we have a really unique opportunity. It has been one of the most positive outcomes of Pets for Life, is that we see there is this universal love for animals, and the bond that people have with their pets, it crosses all boundaries, whether that's socioeconomic, racial, ethnic, geographic, whatever it is, that there is sort of this common language when it comes to animals. And so that provides us such a special opportunity to connect with people and to build trust and relationships. And so in thinking about that, how do we use the power, the privilege, the position that we have to not only serve animals, but to serve people who love those animals? And so it sounds a bit oversimplified, but really one of the sort of most important things that we can do is to extend our compassion to people. Within animal welfare, we have this love for animals. It's why we do the work that we do, while we commit our time and energy to it. But to extend that compassion beyond the animal and to the people who are connected to the animal, that goes a long way in understanding the challenges and the struggles and all of the experiences that people are going through and have gone through. and then to become informed. Part of what we're talking about today and asking the questions and being interested and learning more is to really dig into the issues of racial and economic inequity, and to understand that, for Canada overall, but then to sort of look at what does it mean for your specific province, what does it mean then down within your specific community, and then even within your community, how are things broken down by neighborhoods and by areas, and then all the different layers of that, with socioeconomics, with gender, with different identities, what really start to inform ourselves, because it will make us more effective in the work that we do. And it makes us more connected to other areas and other movements who are doing this work as well. And then with that, taking it and saying, okay, one of our priorities has to be to identify what the barriers are to services for pets. And then how do we start to remove those? How do we work with people to break down those barriers? So whether that is to spay neuter, whether it is just general veterinary care. And so what are the barriers? Is it cost? Probably for a lot of people. Is it transportation, that people don't have the ability to get to and from veterinary appointments? Is it time? Is it that people are working 2 jobs, or during normal business hours they can't take off because they work hourly low wage jobs and don't get paid for time off? Is it sort of positive engagement, that people have had a negative experience before, or they're afraid of being judged or spoken down to, and so we have to rebuild that rapport? What are those barriers? Let's think through and really work to identify what they are, so then we can take them away. And then understanding that this is hard work. These systems have not been built up overnight. It's been decades in the making, and so it's going to take time to start to sort of break them down, and so being patient with ourselves and with each other, that this is work that really does have to be committed to long term. So we need to start today, but we also need to understand that it's going to be something that takes us years and years to really start to penetrate and to start to see a significant difference on. But we can build on that. And then one of the ways that we are working in the States to do all of those things that I just mentioned, and to very specifically tackle the problems that we see people and pets facing, is to look from within our movement and ask questions about our policies and the way that we create policies, and that's both policies within organizations and then policies legislatively, and also then how do we apply and how do we enforce those policies. And so there's just a few areas that we're working on that I thought most, maybe all, would pertain to work in Canada as well. So one is around sort of owner surrenders and then return to owners. And so when people are presenting to their local shelter or animal service agency, are we looking for ways to keep people and pets together in a genuine and sort of authentic way, outside of just like asking a question of why are you here, why are you surrendering your pet? Really listening and asking the right questions of what it is that people are going through, and then are there ways that we can provide support and non-judgment to keep people and pets together? And then when people accidentally become separated from their pets, how can we make sure that it's easy to be reunited? So in so many US municipalities, when a pet ends up at the shelter and a person presents to reclaim that pet, there are pretty hefty fees that are associated with that. And so it makes it very difficult for lower income people to have their pet, to take their pet back home with them if they can't afford it. And then that sort of builds up this idea and this conversation within the community that once your pet, has been picked up or is, within the shelter system, that there's no reason to even attempt to reclaim because you're not going to be able to do so. And so thinking through those policies. And I'd love to hear more from you all in Canada about those and what you see, or kind of how it works. But those are two areas of how do we keep people and pets together to begin with, and then how do we make sure that a large percentage of pets within our system actually do have homes and are owned, and so how do we get them back into those homes? And then through adoptions, are we making that welcoming and possible for everybody, or are we sort of allowing that only for a certain demographic of people to have accessible adoption, and to have that opportunity of how someone acquires their pets? And so how are we treating people in that process? Again, what are the processes that we use to identify what we consider good homes and adopters? And then one that we're very passionate about, and it's not because it's a happy topic or an easy thing to talk through, but when people are in a position to make an end of life decision for their pet, are they able to do that with dignity? And are they able to do it in a way that is minimizing the trauma? And so again, in so many of our jurisdictions, or if someone can't afford a private veterinarian, which you know from the data I shared earlier, a large majority of people cannot in underserved areas. They don't have that personal relationship with a veterinarian, and so they're not able to make the euthanasia decision with that individual. And so if you go through the system to do that, you either have to surrender your pet, and so you're not able to be with your pet in the end, or you have to call the services animal control or whatever that authority might be to come and pick up your pet. And so it's a huge gap in services for us in the US that we're really trying to start to minimize that, and to make owner present euthanasia much more available to people, and just how important that is. It's one of the most significant services that we offer in Pets for Life. And then sort of these last two categories go together, but how do we start to reframe the conversation around what we've traditionally labeled as cruelty and neglect? And that's both from within statutes, but then just also kind of in the dialogue within our field. Because what we have found is that, yes, there are absolutely cases of cruelty and neglect, but real intent and malice, we find, is very few and far between. That the vast majority of these cases that are labeled and defined in this way are an issue of lack of access. And so by providing support, by providing resources, by providing information, most of the cases that get put into that category don't have to be, that we can remedy them. We can bring people into compliance. We can improve situations, not through punitive measures, but through supportive measures and focusing on resources. And then a final way that I wanted to talk through of what we can all start to do today, and that doesn't really have a cost like maybe some programs do or some of these resource provisions do, is in the way we engage in the stories that we tell and the conversations that we have. And I always talk about this from my own organization. It has been a journey within HSUS for us to really have sort of a reckoning with the way in which we have told stories, the way that we have fundraised, the way that we have engaged our donors. And we have all the control over that, but not always considering the consequences of it, that we really like to have a villain. We like to sort of have this us versus them, and please help us against people who are bad. Please support us so that we can save animals from bad people. And there are real consequences to that. Even if it's maybe not overt, oftentimes it's just sort of, subliminal or right under the surface, that we are perpetuating these stereotypes that exist of what group of people are good and what group of people are bad, and sort of what is this definition of compassion? What does that look like, and who is allowed to be sort of labeled as and benefit from this idea of compassion? And so that's something that we see often within animal welfare. And I do know in this area, unfortunately, in speaking to people in Canada, that there are real similarities between the US and Canada and sort of how we engage in this way. And so, we will see these pictures of animals that are in less than ideal condition, that have various health issues, and oftentimes we will sort of assume how that came to be. Even if we don't have the details, people will fill that space with these assumptions and with these judgments, and we use it to evoke emotion, and to really sort of rally people around this idea. And so if you log on to social media for sort of any animal welfare group, or sort of people engaging around the conversation, you see things like this, where people are really negative about other human beings, and we like to say really inappropriate and bad things about people and call names, and that sort of brings everybody together around helping this animal. But what we are proposing in Pets for Life is that it doesn't have to be this way, and that most often when we engage like this, it's not telling the full story. So even if a picture could bring in some money or get people behind you, is that the right way for us to do this? Is there a way that we can do it, that we actually tell the full story, and it be just as engaging, and it be just as inspiring to people, if not more, is to say that other people are not the enemy, that there is this value in bringing people together. And if we want to have an enemy, then that enemy is poverty, that enemy is inequity, that enemy is division. And so let's rally around that and start to eradicate that. So I'm going to leave you with a few considerations, and I kind of got through this a little bit quicker than I thought, because I thought that maybe we would have some conversations, and hopefully we will at the end. But these are thoughts for you in your work and as you engage, whether you're volunteering, whether you're a veterinarian, whether you're working within shelters, whatever your specific role is, for us all to sort of individually and then collectively think through some of these ideas, and how do we make our movement more just and more fair. And so, are we penalizing poverty? Is it because of someone's income that people are being kept from services, or that they're even being criminalized? And in our work, whether it's through our programming or through our fundraising and our messaging, are we maintaining systems of oppression? So not just being complicit in it, but are there ways that we're actually benefiting from that discrimination? Does it benefit us in some way as a movement? And then, are we putting ourselves at odds with other social justice movements? There's been such sort of a public discourse in 2020 around this. And so, is animal welfare sort of ostracizing itself and saying, well, we care about animals more than we care about people? And how does that hinder us? And how does that harm what it is that we're wanting to accomplish? And then how do we sort of make a shift? How do we start to pivot our work to be focused on support, and to have less and less of punishment within the work that we do, and less of sort of that punitive approach, and understanding people, and then providing the support that's needed? And then within all of that, again, sort of going back to that oversimplified idea of how do we increase our empathy? We have it in spades for animals, but how do we then take that and also offer it to other people? Okay, I'm going to stop sharing my screen now. All right. Let's see if there are any thoughts, questions, comments. contributions, additions that anybody has?
Okay, so it looks like there are a few, which is wonderful. So if shelters are interested in taking this approach, and in the absence of large organizations like HSUS, how would you suggest they get started?
There are a couple of ways. One is about reallocation. That's something that we talk a lot about with groups, that there's not always going to be the new revenue streams, especially in the beginning of doing work that is different, that maybe is less known. And so doing it sort of incrementally and looking at, okay, is there this one position that I can take 10 hours a week of it and turn it to some of this support work? And so how can you take what you already have and start to make some shifts? That's one of the easiest ways that we've seen. Two is to look outside of traditional animal welfare supporters. We're actually a very small piece of the philanthropic pie. Animals and the environment kind of get lumped together in a lot of philanthropy. And when you look, it's actually really small. There's much larger areas of support around human health, around sort of community engagement, around ideas of equity. And so positioning yourself, your organization, to be interesting in that way, and to show again what I had said earlier, that we have the opportunity to be invited into people's homes and into their lives in a way that even a lot of human agencies are not, because people love their pets and they love to talk about their pets and they want resources for their pets. And so we have the chance to really connect with people. And so we have been working on that in our program, but with groups as well, of how do you sort of make yourself attractive and how do you position yourself positively to diversify your donor base. And then I would say third is just in the things that you say, not just in the things that you do. So kind of that last part that we were talking about, that there's no price tag to doing, sort of research and finding out details on your community and then talking about that. Whether that's on Facebook or whether that's in your donor newsletters, or just from within your staff, having conversations about that. So I would say those are 3 areas to get started if you just don't have, endless amounts of money to be able to start programs. But to really work towards that, I think that is kind of the goal, is to be able to provide services and resources to people. And so however you have to get there, I think that those are some good first steps to build a foundation.
That's wonderful. Thank you. Now, this is a really good question, and I think a lot of places struggle with this. How do you change a workplace culture that is so ingrained? Like they really feel, I'm assuming the person that asked this meant how they feel that, owning a pet is a privilege. And so how do you change that mentality to actually help the people to keep those pets in their homes?
It is not easy. I think patience is key to that, is understanding that you're going to need to have many conversations with people. It doesn't get achieved just with one exchange. And so really kind of tackling it through a lot of different ways. And I'm a big believer in information and in data. That even if someone maybe doesn't like it, data is irrefutable, it's factual. And so collecting information that has been key to Pets for Life. And sort of 10 years ago, we were in that space where all we heard was, if you can't afford a pet, you shouldn't have one. And people just not being interested kind of in this approach or in this philosophy. And so we really went in hard initially with collecting the data and showing why there was inequity in income, and that it wasn't just about personal responsibility. It wasn't just about everybody who is lower income must have made bad decisions, and so therefore they're not as good of people. We really started being able to showcase and kind of shine a light on the systemic inequities and how The vast majority of people are in situations not because of anything that they did and not because of any fault of their own, but there are these larger systems at play. And I think that helped people start to be able to think about it in a different way, but that took time. And then I think storytelling. So even if you just start with like one person that you're able to support, ask that person, if you can take a photo, if you can share a story, because I think that nothing wins people over like sort of seeing, like being able to hear and see how much this other person loves their pet, loves that dog, loves that cat, and can see a bond with them. And so use that to be able to sort of bring people into the conversation. And then when you can get people in, I think having the data at the ready, really having all of that available so you can share it and you can do it in a way that is comprehensive but yet succinct. That's the way that we've seen it sort of slowly but surely be able to start to shift cultures. And then I'll say, it's not, you always hope to avoid it, but sometimes you are going to lose people. When you make significant culture shifts, there are going to be people that just don't agree and that just aren't okay with change, because change is hard, and that's understandable. But we've seen that within organizations that there are some people who just don't carry over into sort of the new culture. And so being okay with that as well, and sort of having that as a realization and an expectation in the beginning that you're not going to be able to win over everybody, that's okay. And that it's really important to sort of honor the people who are willing to change and who are willing to sort of take that journey with you.
Thank you. And there's kind of a second part. This is actually someone else's question, but it kind of fits into the same thing. So I'll ask this one in two parts. So is there donor resistance to helping keep pets with owners because of prejudices about people not being able to provide veterinary care, letting their animals outdoors, as well as what about people that want to donate to fracture repairs and then don't find vaccination so interesting? So how do you really get donors on board?
Yeah, it's a great question. And I would say that's like the number one question that we get. And so I'm going to share a link when I'm done speaking, because I don't think I can multitask. I'll mess something up if I try to. But we created a sustainability guide because what you just asked is what so many people were asking. And so there are groups that we're able to work through this because they're our partners and we can do it directly with them, but we needed a tool that could help anybody sort of at their own pace and in their own time go through it organizationally. And so it's a pretty lengthy guide. It's broken down into 4 chapters. So I'm going to share that with you all because I think that you'll get a lot of use out of it. And it goes into a lot more detail than what my answer will be here. But the short answer is that there are going to be some donors who aren't interested. And so you'll have to sort of take that traditional route of maybe you can't get them to care about people, but you can get them to see that vaccinations are good for animals, for disease control, or for whatever that might be. And so you can cater the message a bit, to specific donors. But I think what we have found overwhelmingly is that, one, there are actually more people interested in this type of work. And I'll give you one example. In 2016, we had what was called this Day of Giving campaign at HSUS. And we had been struggling, Pets for Life had, in getting HSUS to understand the program and to feel comfortable with how to market it, because it was so different and new for HSUS as well. And so we put together this campaign that was going to be a 24-hour period, this Day of Giving. And because we're a national organization, the goal was to raise $150,000, and we were going at it through social media, through text messages, through emails, all the different paths that we have in connecting with our members. And we were adamant that this was only going to be positive storytelling. We were not going to fall into the traps that we did in other ways in the organization, and that what we were going to call out was that resource inequity. So we talked about pet resource deserts. We talked about the lack of accessibility to veterinary care. we told stories of people and how that bond was so special with their pet, and we wanted to honor that love. And we ended up quadrupling our goal for that day. And it was, that campaign had more first-time donors than any other campaign that HSUS had done. And so it was something that we knew within PFL was possible, but we had never had the attempt made by the organization. And so it was a real moment for HSUS to say, oh, wow, okay, this can work. Because we had kept hearing from our philanthropy and our communications team that, no, this is the sort of tried and true method of fundraising. This is the way to do it. This is the formula. This is what works. And we were saying, but you haven't tried anything else. And so how can you say something else doesn't work? So I share that to sort of encourage and incentivize, because we have found that it does work. There has to be a commitment to it. You have to, sort of put together a campaign of sorts, and sort of be ready to follow through on it. But we have found that every time we really push out this messaging, we get a great response. That doesn't mean that you don't have people who say stay in your lane, or this, I just love the animals, I don't want to hear about this other information. That'll happen too. But we have had a net gain across the board.
That's wonderful. So this is kind of all, everyone's asking very similar questions, but they're all coming from different angles, which is great. So Lori asked, how do you encourage underserved communities to engage with you for help?
I don't think it's about encouraging underserved communities. I really think it's our responsibility as service providers to listen to and understand the community's perspective. And so it's about an authenticity. It's about engaging with people without an agenda other than learning and being of service. And we have found that when we do that, it's not a question of how do you get people to open the door. It's what do you do when everybody opens the door? And so it's really about the approach, and it has to be done, again, sort of with a sort of genuine spirit of, we are here to be of service, and we want to hear what your experiences are, what your concerns are. And I can say just categorically, with that approach, we have absolutely never haven't had an issue. It really has turned into, how do you then sort of meet the demand that comes from within the community? And I think why we've struggled before is because we've gone in assuming that we know what a community needs and wanting to assert our values. And then that's where you can meet the resistance. So I really believe 100% that it's about the approach.
And what do you do when your demand exceeds your capacity to serve? And how do you decide when you will and won't help with specific situations? For example, fractures, diabetes compared with vaccines, spay, neuter. How do you make those decisions? So
the way that we have gone about it is to have a sort of geographic focus first. So anytime we start in a new community, whether that's a large city like Chicago, or it's a small rural community in Idaho, or we're working on Blackfeet Nation in Montana, we do a community assessment. And so through that assessment, we look at all categories of demographics for people. And then we sort of create a visual and a map around that. So we can see, okay, here's where the highest concentration of need is, where we have the highest rates of poverty, and there's not a veterinarian for however many miles, or there's not other resources. And so we will start in that community first. So instead of trying to be everything to everybody, we have found that we're actually able to reach more people and pets quickly when we sort of saturate, stabilize, and then migrate. That's kind of how we talk about it. So we're not just like throwing it out to an entire city or to an entire county or an entire state or province. We really focus in, so we know that we're reaching people that don't have any other option first, and then we're able to sort of grow out in a ripple effect from that. But then on top of that, we also have limitations financially. And so we are very open and honest and transparent about what we can provide and what we can't, and then we stick to that. That consistency is key. So if in a community, say to begin with, all we're able to provide is spay, neuter, and vaccinations, and maybe, you know, some basic wellness like dewormer or flea and tick prevention. We're very open and honest with people about that. So if there's a more in-depth medical need, we don't just tell someone, oh, sorry, we can't help. We think through what's the incremental care. You know, are there ways that an animal can be kept comfortable? What are the quality of life issues? And so it's sort of this menu of options, and it's not either we can do a $5,000 surgery or we can do nothing. We really want to work with people in the middle of that, knowing that you know, we can't provide $5,000 surgeries to every animal that likely, you know, could present in needing that. And so we set parameters based on whatever our budget is from the beginning. So we do all of that before we start a program, before we knock on a first door, before we talk to the first person. We have all of that sorted out on paper. We know where our focus area is. We know what services we have to offer and what our limitations are. We know what our budget is. And so then we're able to, from day one, be able to share with the community what we can and cannot do. And again, we've had a lot of success in that as long as we are open and upfront and transparent, people really seem to understand that. But then we really work with people through situations. Again, it's sort of not just this either or. It's like, okay, let's work together to find what's possible and what a solution can be with our limitations, and to set people up to succeed.
That's wonderful. In terms of that, is there a mechanism being used by Pets for Life to identify and nurture the interest of people within these communities to help as local veterinary healthcare workers? Linda also asked if there's a way to sort of attract volunteers from within the community to help.
Yeah, that actually happens naturally with the approach that I've mentioned. It's very holistic, and that there are people within every community who are already sort of helping neighbors and working within their neighborhoods. And so when a program goes in, you're able to identify who those people are, and people naturally want to pay it forward. So we very much have volunteerism from within the community. We're just careful not to make that a requirement. We don't go in and sort of have this, if you want a service, you must give so many hours of volunteer time, or if, you know, to receive this at no cost, then you have to, you know, do something in return. So we don't set up that dynamic. We understand that people who are struggling financially have a lot of stressors in their life and a lot of pressures on their time. And so we actually want to alleviate that. We want to make it easier. But through not setting up kind of that expectation, what we see is that people say, how can I give back? You know, how can I contribute? And the best way that we have found, and what we tell people, is to tell others about your experience. Let your neighbors and your friends and your family know if you've learned something, what you've shared with us and how we have learned, and then to sort of pay it forward in that way. And that makes our work even easier when the conversation is happening from within the community, that sort of, you know, adds value to our work. So yes, we definitely have participation from within the community. And as much as we can, we try to elevate that. So within Pets for Life, we have many staff members who started out as service recipients and then potentially as volunteers. And then when we had positions open up and we were able to hire, we really looked from within the community to do that when possible.
Thank you. That's great. So I have two more questions and then we'll let you go for the day. Thank you so much. The first one is, does HSUS have resources or a model to support a shift to owner-present humane euthanasia, specifically interested in resources for a humane society to shift from surrender-based euthanasia?
We're working on that. We don't have anything formalized that we can share right now because we're still in sort of the data collection phase. It's such an important topic that we wanted to be really careful and deliberate about it. So what I'll share that we've learned so far, and 2020 kind of derailed us, as I know it did, probably all of you in various ways. We had all of our plans and all of our goals for the year, and then that kind of all went to crap. And owner-present euthanasia was one of those. And so we had started collecting data from shelters that offered owner-present euthanasia and asking how they were able to do so, what were the important pieces of it, and then what challenges had they faced, and then what were their lessons learned. And then for organizations that weren't offering it yet, we were asking why. What are the reasons that you can't? And what we heard were two. There were a lot of different reasons, but there were two that sort of rose to the top. One was training, that staff didn't feel as comfortable providing euthanasia with the owner there as they did being able to do it on their own. And so we're looking at how can we create greater training for shelter and vet tech staff on that. And then two was a space to do it, which was a little bit of a surprise that it was something that is a little bit easier in remedy, is that, you know, a lot of the actual physical buildings didn't either have the space or it was crowded and people didn't think that it would feel positive for people, or they just didn't have like the right setup, like the right table or whatever it might be. And so those are the two things that we were hearing. And so that's kind of what we're working on and putting together somewhat of a checklist, but then also a toolkit kind of how, knowing that these seem to be the biggest challenges in it, then what can we provide as HSUS and learning from organizations to help groups walk through being able to make that change. But we don't have anything yet.
That's great. We'll all look out for that when it comes out. That's amazing that you guys are working on that. So the last question is understanding resource limitations. What do you do in cases where you cannot help? For example, fracture repair. Do you turn them away? Do you provide them with humane euthanasia? What is the next step?
Yeah, just that. I think we always look at, and I'm not sure if the language is the same, but what we call it is incremental care. And so that's always sort of our first attempt when it's something that is extreme or that has a really big price tag of, are there ways that you can do pain management that, you know, might not be perfect in result, but that can be adequate. So that's kind of our first way of approaching those situations. And then when there is simply just something that we're not able to accomplish, or that is not going to set someone up to succeed, we do provide euthanasia. It really is one of the more important services that we offer. And so again, we very much sort of hold the hand of the pet owner and walk through that process with them. It's some of the most emotional and moving and yet impactful situations for us is when we've gone through that with a person. We were just dealing with it yesterday with our Philadelphia program that we had a Chihuahua puppy. And we had tried a couple of different things that just didn't work. And so that's where we had landed and sitting with the family, you know, our staff sitting there with the family during that process and just how grateful the family was for that. And I think that is, well, if it's any indication of what we've seen in the past, that's going to be a relationship that we have for a long time. So yes, that is the unfortunate reality. But until we have limitless amounts of money and capacity and infrastructure, that there are going to be times where euthanasia is the best option.
Thank you so much, Amanda. We really, really appreciate your time, and we've all learned so much from you. And this is the part that I miss the most in live conferences where we can all give you an applause. But thank you so much. We really appreciate you sharing your expertise with us.
And Stephanie, I just want to point out to everybody that I put the link to the sustainability guide in the chat. So it's at animalsheltering.org/pets4life/sustainability guide. But if you just search Pets for Life there, you can go to the tools and guides page and the sustainability guide is there.
I'm just going to send that to everyone. It just sent it to the panelists. So let me just.
Oh, I'm sorry.
Here.
See, I knew I would not do that.
No, you did well. We can all see it now. Thank you so very much, Amanda.
All right. Thank you all. Have a great day.
You too.
And everybody cross your fingers for the United States that we have some resolution this weekend.
Our thoughts are with you guys for sure.
I saw a great meme that said we all need our emotional support Canadian friend. So if anybody is looking to adopt, I'm here.
That's so funny.
All right. Have a great day.
Thank you. You too. So now I'm going to introduce our second speaker of the day, and it's Alison Brissett. Alison Brissett is from the Chippewa of Kettle and Stony Point, but resides in London, Ontario. Alison founded Aboriginal Community and Animal Advocacy Connection for the purpose of providing accessible and affordable animal welfare resources and services, such as veterinary care for dog and cat populations within First Nation communities. One very important aspect to ACAAC is to assist First Nations to establish long-term partnerships that will provide animal welfare services and resources to the communities. ACAAC strongly advocates for the duty to consult and accommodate First Nations communities to achieve reconciliation. It also operates to bring awareness, to promote animal welfare, the human-animal bond, respect, empathy, compassion, and to improve animal health and well-being for First Nations animals. Welcome, Alison. So Alison, you can go ahead and
kind of bright looking here. I have my patio behind me. Can you hear me?
Yes, we can hear you and see
Okay.
your presentation. You're
Okay,
great, thank you.
Okay, so that was a great presentation, Amanda. I really appreciate that, especially the question and answer period. These are the types of organizations that I would love to work with. Having different experiences over the years with various organizations. This organization to me is absolutely professional, and they totally understand communities such as Indigenous communities. So I'm going to start my presentation. It's the realities of animal welfare in Indigenous communities. So good morning to everybody. And I am keeping the United States in my prayers. And let's just see if I can't seem to get this going here. There we go. So Aboriginal Community Animal Advocacy Connection was established in 2017 as grassroots. I started on my own, something that I had wanted to do for years since I was a child. I didn't really know what it was in my childhood. So as far as Aboriginal Community Animal Advocacy Connection goes, we serve all First Nations communities who seek us out, who are seeking to implement animal welfare services to increase the health and well-being within their communities. We focus on awareness, education, advocacy, and services for First Nations. We are extremely dedicated to improving the lives of owned and unowned cats and dogs. We work to alleviate the suffering of animals, to promote care, compassion, along with improving health for animals and their well-being. So I'm back, continuing on about the parallel. I'm having a lot of feedback. Is it the same for everybody else?
No, you sound good on our end.
Okay. So I could identify with the dogs and empathize on a very personal level because of the parallel that existed between my life and theirs. I felt their suffering and wished that they would not suffer. I saw the starvation. I saw them wandering and not being wanted. There was always a sense of desperation and urgency that was always present to wanting to do something to help them. It's something that never escaped my memory well into my adulthood. I had always wanted to do something about it, but just didn't know how. Like them, I was alone and looking after myself. I was not anybody else's responsibility, including the dogs. Many of them were strays. There was neglect and abandonment. Many are dumped, also by non-Native people within our communities. We were both marginalized, and there's racism towards even myself and the animal. There was no equal accessible on-reserve healthcare, and definitely no veterinary care. So we were in the same boat. In the same way, this is the state of the animals on reserves across Canada, and I imagine North America as well. Next. So we were a mere reflection of each other, our communities. There's only suffering for the lack of services, which ultimately there is only suffering and death for the res dogs without the services. We have been in the same situation. I went days without medical care, not having anything accessible on the reserves. I had infections in my eyes and on my body. And in the same way, I saw the dogs suffering. We were a mere reflection of each other. Communities are a reflection of the state of the animals. I've seen this throughout the years in animal welfare. If a community is in poverty, so are the animals. If a child is in poverty, then so are the animals. If a child goes without food, then so does the animal. If there are no services for children, then there are no services for animals. Example, medical, sanitation, hygiene. Although there are now some communities that have healthcare services, there are still no animal services, resources, or infrastructure. Next. So identifying with the res dog. When I was a child, I was able to identify with the state of the animals, in particular was the res dog. Poverty and food. We went days without food. Malnourished and underweight, in a combination with poor health due to the lack of veterinary care. The ongoing search for resources. So as a child, I went without food and would go to people's homes in hopes to be fed. In the same way, the dogs do this, primarily the strays. We also have community dogs, own dogs that do their visiting around the community. It's not to be misconstrued with the stray population. There is a free roaming population of owned animals that do this on a daily basis. There is a mind of poverty through hoarding and guarding and fighting. Growing up, I hoarded food a lot. There was guarding within my home of food between the siblings. In the same way, you see this with the animals, the fighting for the food. And there's a hierarchy. Sometimes I would go to homes and could not be fed. Others were fed first before me. And in the same way, this happens with the animals. You become accustomed to hunger pangs. You don't feel it anymore. And I can imagine for the dog, it's the same way. There's the gorging and gobbling. I've seen this with my own siblings, eating everything in the home. And so I see it with the dogs where they fight and they try to eat food as quickly as they can. Next. And then there's colonization and residential schools, the aftermath, the role of the dog. In the past, there was hunting and sharing. Pups were only taken out of the bush for essential purposes. They were there for companionship to hunters, protectors of hunters, and guarding communities. They were used for travel, moving, and ceremony. Today, we have unwanted litters, overpopulated numbers of dogs. They are displaced and have become nuisances. Begging from home to home, learning not to ask, instead simply hope, learn not to outstay, not to trust, being in the way, go on, get out of here. So in the same way, there's the mere reflection, there's the parallel, because this was the existence of my experience. And I can imagine that there are other children that grew up in the same way, feeling the same thing. And I hope that communities would start to move forward to be able to help children and the animals out of these types of situations and help our animal population come out of the state of nuisance that has been created due to colonization and residential schools. Next. From essential to nuisance. Once respected, the overpopulation of res dogs has been degraded the dog to mere nuisance. Yet we should be able to respect the dogs and what our ancestors valued for our survival. Acknowledging the loss that we've had, striving to regain a system, giving back to honor the dog. So with the overpopulation that we have, there's so many not just free roaming animals that are owned, but the stray population. And this is what has created the sense of nuisances of the res dogs, and for numerous different reasons. Next. The res dog experience. People have simply known it no other way. It's just the way that it is, because there have never been any solutions, yet so many want to have the ability to provide for their pets and to help strays that come to them. Throughout the years, people have come to me wanting to help the stray population, struggling to meet their needs. They struggle to meet their own needs within their homes. Yet they see the stray population suffering, and there had been no options, no solutions in the past. But with the organization, we are striving to provide solutions for people, options, so that people don't see it as just the way that it is. So for the res dog, they've been marginalized. There's been instances where veterinarians haven't wanted to work with res dogs because they're considered sick. They don't want to have them around their other animal clients. I have been turned down for help in the past based upon this. This also includes rescue groups that have turned down helping the animals because they're too sick. Marginalization in the sense of inaccessible veterinary services, no shelter contracts due to the lack of no specific funding within First Nations, multiple births, a threat to health of the dog, the super breeders, they can have 3 litters per year. Without spay and neuter, animals suffer, litters die. The animals are marginalized just like our communities are. They can be treated in the same way. It's a sense of racial injustice to animals. They are judged like we are judged. The overpopulation, owned and unowned, unwanted, poverty, just another mouth to feed. There's just so much poverty within many First Nations communities that people cannot keep up with the amount of animals that are there. Many are unwanted, and people just don't have a solution as to how to rehome animals. There's calls due to the overpopulation. The lack of spay and neutering contribute to this factor. The number of dogs cause them to be seen as nuisances and dangers, which it makes sense because it's a danger to children specifically. There's no funding for animal welfare services within First Nations communities. We are under the federal government, and the money that we do have is in a trust fund, and nothing is specifically geared towards animal welfare. Generally within communities, there's 3 to 6 dogs within households that don't have spay and neuter or rehoming. Some caretakers have had up to 28 strays that they're trying to care for at one time. And that also includes feral populations of cats now. Because of this, dogs are in danger of being harmed or killed. It's a huge public health and safety issue within communities. It's actually one of the top 10 public health and safety crises for First Nations communities across Canada. There's increased risks of dog bite instances, greater risks of dog mauling deaths. Indigenous children are dying across Canada. They die in greater amounts from dog mauling deaths than any other communities within Canada. Simple human issues such as garbage being ripped apart, bleach is used. These are situations that cause nuisances within communities. And it may not seem like a huge issue, but when it's year after year after year after year, week after week, it is a struggle that First Nations do have. And that's only one little example. That's just the garbage. Next. So with the res dog experiences, the overpopulation, no resources, no services, starvation, illness, extreme stress, suffering, and death. The following images are experiences that I've had with animals and that community members have had with animals that are in their care, whether they're stray or they're owned. These 4 adult dogs here came from a community along with the 2 pups. I can't minimize the screen. I can't see everything. So I can see the chat, share screen, everything along the bottom. It's covering up words.
You can close the chat screen if you would like to.
Okay,
You can just hit the X on the top right corner.
Oh, there's no X on my screen. Let me just see here. I'll go to, even at full screen, it's not showing. Fit to window. So anyways, these 4 dogs here came into my care. They had congestive heart failure. Definitely one had passed on through her treatment. The puppies did survive. These all came from one household. Not having affordable, accessible veterinary care is a contributing factor here. Families struggle to care for their animals. There's high heartworm rates within certain regions. And these animals, the certain community they came from has the highest rate of heartworm. And many of the animals end up dying from it. And families witness this, the children witness this, the pets going through this. Not that it's seen as normal, but it's seen as the way that it is. The next dog, Rex, he was attacked by 2 other dogs. He went 3 days without veterinary care. There was a lot of blood loss. At least 2 buckets of blood were mopped up. Eventually, while working with a family, we were able to work it out with family members to help contribute towards his care to get him to the clinic. So that was great. A lot of times families will work together, or even community members will help each other out in extreme cases such as this. And Rex did survive, thankfully. Next. So no accessible or affordable services. Again, illness, injuries, suffering, death. Max here he ended up coming into my care and went to rescue. He had heartworm disease. He had been abandoned. Through his examination, 3 buckshots were found in his chest area. He did survive, thankfully. He came to my knowledge through community members posting him on social media. They were upset by the state that he was in. He was kind of like a community dog. People were trying to take care of. Our community really speaks out for the animals. They hold each other accountable now. In the past, it wasn't like that. Our animal welfare has really grown within my own community. The next guy here, Champ, he came into care. He had heartworm, 3 buckshots. He had been hit by a car a number of years before. For 2 years, he hobbled around with his front leg extended out in front of him. He ended up passing away through his heartworm treatment. And it was very severe, and he was suffering a lot. He had been adopted, and so his adoptive family saw him through that process. He was also seen as a community dog, but he was owned. The next girl, Coco, she was beautiful and gentle. She had numerous litters. She was apprehensive of people. And ultimately, she ended up being shot and killed by the police because of her behavior towards certain people. I never had a problem with her. The next girl, Bear, she was owned. She got shot by a community member that had been shooting dogs for years. I grew up with this person doing this to numerous dogs. Something that stuck in my mind as a child, knowing that this was happening to our animals. So the owner of Bear was able to get her veterinary care, and her leg was amputated. She survived. The same owner was looking after the next girl here, Girl. The girl was a stray. She was deliberately poisoned with slug bait. I spent the whole night with the caregiver on the phone while Girl suffered. I was sent videos of what she was going through. 3 hours of shaking, convulsing, rigid legs, panting, nonstop panting. It's like she couldn't even get a breath. And so this community member was in this situation with her son. An aunt and uncle came, but there was no help. The police wouldn't intervene to even put her down. Eventually, a community member did. A community member that wasn't supposed to be using a gun. And he said, just make sure nobody, just don't tell anybody. It was a horrific situation. Both the caretaker and I had PTSD. And so for days after, we couldn't sleep. It really affected our symptoms. And the same community member had severe trauma growing up, being in a situation with her mother dying, her being with her mom. So this just put her back into a situation that resembled such as her mother, where there was no help. It's something that I'll never forget, and it really upset me. And I sent emails out to the police, to the band, to the school. I said, we really need to do something to change this picture for our community members, for our children. I said it was such a poor example to the young boy to see that there was no help in that situation, to see a dog suffer in such a way. It was so horrendous. Next. So the next girl, Zoe, her family couldn't afford her veterinary care. She had been hit by a car. And although I don't like to suggest people surrendering pets to rescues in order for them to be helped, sometimes that's what's needed. So Zoe was taken care of. Her leg was amputated and she was rehomed. It was a very hard decision for her family, but in most cases, the families will opt to surrender their pets so that they don't suffer. The next girl, Precious, she's from another community. Heartworm again, in the community that has the highest rate in our area. The vet had drained at least 10 liters in the beginning of fluid from her abdomen. She went through extensive heartworm treatment and suffering. She did survive. I don't know how many years she ended up surviving, but I know that she was no longer suffering. She was a stray, so she had somebody to care for her now. Charlie was dumped in our community. It's a known fact around reserves that people bring animals and dump them in reserve communities that's seen as a dumping ground for animals, just like the cars. People bring stolen cars to reserves, they burn them. And in the same way, people bring animals and do the same, which makes no sense to me, considering it's a marginalized society that they're bringing these animals to. This happened to Molly and Daisy as well. They were dumped in our community. There was witnesses in this case. They saw the people dump them and left them with a little blanket that they were tugging on down the road. I was called right away, and a community member kept them for me until I could pick them up. And eventually they went into a rescue group. So over the years, I just want to explain that being grassroots level and working within my community to start, all the animals came to my home. I live in London. My community is an hour and 15 minutes away. And so the animals would come into my care until I could find a rescue. Sometimes I could find a rescue right away. So there was a lot of bonding with animals, even if it was for a few days. These girls here stayed with me for a few weeks before they got into the rescue. The next guy, he was a surrender. Wile E. Coyote, I called him. The caregiver said that he was at their home for 2 years. At first, they said that he was owned by them, and then just said that he was a stray after I asked for a signed surrender. He suffered a lot. He was emaciated. You can't tell because of his fur here. During his surgery, 3 goose egg sized fur balls were found in his intestines, along with sticks and pebbles. He ended up bloating. I rushed him to the clinic. Dr. Bob was great for always helping me out. And he ended up passing on the way home. He hadn't made it into rescue yet, unfortunately. Next. So the exposure and risks to the animals, they could be owned or unowned, animals without veterinary care. So the extreme temperatures, ones that go without shelter, no protection, winter months, extreme loss. A lot of them look emaciated by the end of the winter time. Their depleted energy source, of course, for trying to keep warm. Poor body score. They go through a lot of different experiences in different regions. Depending upon, Southwestern Ontario to Northern Ontario, all across Canada. Some of the major issues within my community, which let's say prevented people from bringing their pets into their home, even though they wanted to bring them in, were things such as fleas and ticks, very minor issues to deal with. That would eventually turn into, more serious situations. The dog attacks that's like between animals that occur, the stray population in particular, unaltered, fighting over females. One in particular, there was only about 3 females left in my community to be spayed, and the dogs broke into her backyard and were fighting over her. And one of the dogs he was the senior. He ended up passing 3 days later. Wasn't able to make it to a veterinary clinic for care. The other issue with pregnancies, the intact females or dogs fighting over them, and eventually they can become killed by the male dogs. And then there's issues of a lot of parvo in some instances, depending upon from year to year. It might be distemper, might be parvo. So animals having diseases, risks of rabies, which in turn really affect children. Children are the ones that are outside the most, being exposed to free roaming population, whether owned or strays. So it's a big issue for First Nations to have accessible, affordable services for veterinary care to help keep children safe. Next. So equally accessible services. The lack of affordable, accessible services and resources. It spells suffering, severe distress, excruciatingly painful, dying from heartworm disease. I don't know if anybody has seen the process of this happening, but it's horrendous, and horrendous for families to see their pets go through this and children to witness this with no solution. The situations of emergencies that community members deal with, the human PTSD issues that are rampant within Indigenous communities across Canada. That's due to residential school. There's many times where there's no solution except for shooting the dogs. There's no other way for many people, not being able to afford euthanasia. I think people don't understand the severity of poverty in a lot of instances where you don't have anything to eat, much less to pay for a humane euthanasia. So a lot of times this is what happens, and society points fingers, not understanding this full picture of no veterinary care, no accessible or affordable within these communities. And a lot of people don't have transportation to even go to a nearby clinic, even in Southwestern Ontario. The closest vet to us is in Forest. It's 12 kilometers away, 15-minute drive. It may as well be 100 kilometers away for some. Animals don't make it there. There's no shelter contracts. Communities don't have the funds to pay for that. So when there's unwanted cats and dogs, strays, there's no place to take them. And the funds for First Nations or Indigenous communities, it's federal. It's our funding. It's held in trust. We have no control over it due to the Indian Act. Therefore, there's no animal welfare. It's no wonder that dogs are shot. And it's something that I wish society would understand more of, that this is why it's happening. And next. So 2020, this should not be happening. No veterinary clinics, hospitals, or exemptions in accredited mobile units. And there are 3 exemptions in Ontario now. And the first one was in 2015. We have 209, 210 Indigenous communities within Ontario alone. I think that paints a really good picture about the level of suffering within Indigenous communities for animals. There's the red tape, the codes and regulations that are barriers. The injuries and health risks most prevalent, again, is heartworm in many areas. Being hit by cars, all that I mentioned before. And so what ends up happening is communities are left to ignore it, turn a blind eye, being defeated. This is the same thing that happened in residential schools, the intergenerational impacts. This is what children had to do. And so now this is a repeat behavior, even in animal welfare, you know, having to turn a blind eye more, being defeated. People stop asking for help. Complete poverty and poor state of animal welfare. People can only watch the animals suffer. They try, but what can they do if there's no services, and if they're not affordable, not accessible to communities, within communities? So both communities and animals have been excluded and forgotten. We were never included in the progression of animal welfare. Next. So imagine this. This is Amy Lee. She was the first dog that I started working with. She passed a couple of years ago. Before I met her in 2007, she had at least 3 litters. She became a super breeder. And this is very common. And I think for a greater part is unknown to veterinarians, I think, because for most part, people think it's 2 times a year. Well, with these dogs that get into the cycle of breeding, they can have up to 3 litters a year. Amy had at least 30 puppies before I met her. By the end, she had between 120 to 129 puppies before she came into my care. So in 5 years, that's how many puppies she had had. And if you can imagine, she's only one in thousands of super breeders across Canada within Indigenous communities. Next. So Amy averaged 10 to 11 puppies per litter. It's a lot of work for her. Her last litter, she gave birth in my home. She also had been going through heartworm treatment at the same time. It wasn't found out that she was pregnant. I don't understand why not, because she ended up giving birth 2 weeks later. She ended up losing a couple of her puppies during that time. But in the duration of the births that she had, most of her puppies had died before coming into care. They died of exposure, disease. Some of them had drowned underneath a porch one time. Some were found in ditches, and I can imagine a number of them wandered off. And so this is what does happen with strays and owned dogs. this is how a greater part of the stray population exists within communities. Puppies wandering off for the lack of resources. Next. So these are just some pictures of some of the litters that I picked up over the years. I've picked up hundreds of animals. I have the privilege of them being in my home. A lot of work, but they came to my home before going to the rescue group. The way that it operates now is usually the rescue groups, I set it up with community members. I'm the advocate in between, and the rescues work through me and then one-on-one with a community member to either pick up or community members transport to them. In the past, I did all the pickups. It was only me that worked between rescue groups and communities. I only work with trusted rescues, and I've narrowed it down to 2 within Southwestern Ontario that I work with now. There are other ones that if I ever need to turn to them, there are a number of them that are reputable and ethical and that I can depend upon. Because now I have reached out to other communities than just myself. So my community at one point, I was working with at least 12 rescues in Southwestern Ontario. From where I live to my community is an hour and 15 minutes away. Other communities could be 2 hours away from me that I work with, and then taking them, 4 hours away to find their rescue. Next. So there's the escaping life of solidarity, confinement versus the free roaming population, not just strays. So these are a couple of dogs within my community that are chained. There's the idea of preserving the free roaming res dog. It's historical. Some refer to it as cultural and natural, yet it has its pros and cons versus the chain dog existence. Next. So I've seen the chain dogs. It's a lonely life for them, day after day after day. Sometimes the only interaction is feeding and watering. I worked with a dog named Shelby for a number of years, and she suffered greatly in this way. Even when I was able to get her a kennel, it didn't seem to alleviate her suffering. It was a case of neglect, and community members were concerned about her. I would get phone calls about her. Eventually, she was taken to the Humane Society by somebody, and she was never claimed. And the Humane Society did tell me that she was adopted out, and I'm thankful for that. It was a situation that both my daughter and I had experienced, trying to work with her and provide for her needs through the years that we knew her. So with the chain population, it can be difficult to rehome them because they end up with behavioral issues, aggression. I do not promote chaining. I am pro free roaming population in place of having a chain dog. Next. So these 2 boys here came from one home, and for a while they were without shelter, full exposure, no tree line hitting them throughout the day. And at one point during one of our visits, they had a canoe between them to which neither one of them could reach, and it had the green, stale water in it. Thankfully, with my work with community members, one of the owners did contact me about them to have them rehomed. She said that it's not fair for them. And I knew eventually that she would contact me. She does love animals and just sometimes didn't have a solution as to caring for them. So I was very happy when I received the phone call from her and they were rehomed. You know, the community member, you know, said that she couldn't care for them properly and that they deserved much better than their existence in the backyard. Next.
You are so courageous, Allison. Thank you so much. How would you feel about stopping? It is 10:30 now, so that we could take maybe one or two questions. You have so much to share with us, and I really appreciate it. And I hate to interrupt because I could listen to you talk for hours. But how would you feel about taking a couple of questions if anyone has some questions? Or do you?
Sure. Could you just flip through some of the slides so people could just see what else is?
Yeah, absolutely. Yeah. And you just tell me when to stop, when you want me to stop.
Okay, if you could just go back back to where we were. Yeah. So I talk about the free roaming population, the pros and the cons. And so next, the community experience. It's great to see the evolution of the beginning into where we are now. Like my community has totally embraced animal welfare and the veterinary care that comes. They are full participants, volunteers. In the beginning, there was so much apprehension, even for me as a community member coming to them. So next. Grassroots. Everything's about awareness. In every which way that you can bring awareness into community, do that. Work with community members. It's very important, and go by their direction, not your own direction. Don't assert your own ideas. Communities know how it's going to work within their communities, what speaks to them. So next. And I really wanted to talk about, you know, if things are intentional or are not intentional. And it's a lot of unintentional situations that seem like cruelty. And within society, they're pointing fingers at First Nations, and we have rescue groups doing the same thing, coming into our communities. And they have no knowledge of really what's going on within our communities. They invite themselves to come. So next. The next. They don't realize the psychological impacts that are occurring with us, and then also how the structural racism and systemic racism is imposed upon us through even the rescue groups. I'm talking about unethical rescue groups, pop-up rescue groups. Next. Next. That human-animal bond is healing to us, and we really need this within our communities. In this way, it'll help our trauma from residential schools. We need that human-animal bond. We need to be able to care for our animals properly. So if the people who are listening, if you're in a humane society, if you're a veterinarian, please consider working with the community, being a partner. Next. We talked about the mauling deaths being highest in Indigenous communities, children, 180 times more to be killed by a dog. Next. Next. Next.
Allison, this is amazing information, and I'm sad that we're having to skip through it so quickly. Would you be amenable to doing another webinar just with you so that we could get all this information?
Yes, that would be great, because
And we've
there's so
had-
much more.
We've had so many people in the chat come up and thank you for sharing all of your experiences and wanting to know more from you. And we wish we had more time. So
Yeah.
it's so powerful, and it's so important that we all get a chance to hear what you have to say. And we really want to take the time to make sure that we can fully understand everything that you have to share. So
yes, and if people would like a copy of the presentation, like a PDF form, they're more than welcome to, if you would be able to forward to anybody.
yeah, well, actually, all of the PDFs from the presentations will be up on our website.
Oh, great. Okay. I'm glad.
Yes, so everyone will get that information, but hearing you speak about it is just, it's so profound, and we really appreciate you taking the time to speak to us. And if what we'll do, everyone, is we will set up another time to hear the rest of Allison's talk, because it's so important for us to truly understand what's happening. So for now, Allison, if you're okay with it, we'll maybe finish and then go on to the next speaker, and then you and I can chat and we can set something up. And I just want to thank you so much for being so kind and courageous, and we can all learn so much from you. I really appreciate it.
I hope that I spoke well for my people, to paint the picture that we have lived in. And I want to honor the res dog and to get help for them, just as much as we want to be able to help them. And thank you for the opportunity to speak today.
Thank you so very much. We really appreciate it. So we're all applauding you through our computers. Thank you. And we really appreciate it. And it's very emotional, so I'm having trouble with my words. Sorry, guys.
It is very emotional.
It is.
The actual lived experience is very emotional. It's very difficult, and people live through this all the time within communities.
And it's so important for us to understand that. So thank you. Thank you.
Thank you.
So I'm going to introduce our next speaker. Our next speaker is Dr. Ellen Jefferson. She has been the executive director of Austin Pets Alive in Austin, Texas since 2008, and has led the organization's rise from a grassroots rescue group to a national thought leadership. Under Ellen's direction, Austin achieved a nearly 96% save rate for homeless animals. Ellen founded Emancipet in 1999 and led this organization for 9 years. She has served on the National Spay-Neuter Task Force from 2007 to 2009 as well. So please, everyone, help me welcome Dr. Ellen Jefferson, and you can go ahead and share your presentation now, Ellen.
Great, thank you so much for having me here today. It's a hard act to follow, the last speaker. That was a really great presentation and information. But I'll do my best, and let me go ahead and share this. Hopefully it's working. Is that working okay?
Yes, that's perfect, thank you.
Okay, great. Well, I was invited here to speak about the Human Animal Support Services project that is happening since COVID started in March, and it's really new. And so we have, it's likely lots of things will change, but I wanted to share where we are now and what we're trying to accomplish. So the question is, why start this? Why start the Human Animal Support Services project? And we probably all agree that we have pretty intractable problems within our industry, within the sheltering industry, and actually the animal welfare industry. And a lot of it can be summarized with the 6 million pets entering American shelters every year. That doesn't even include shelters that are in other parts of the world. And in that, 1 million of those pets die in shelters in the name of population control, meaning that those animals are euthanized because there's not another solution for them, adoption or return to owner. And we have come to collectively realize that modern animal sheltering is built upon a pretty faulty history, and not that we could have been able to see the future way back then, but the premise of sheltering was started over 120 years ago, and it really is based on removing animals from the streets. Back then, it was in an effort to decrease the spread of rabies, which was spread mostly by stray dogs. And so using Austin as an example, because that's where I'm from and I've done a lot of research on Austin, the method of removing dogs from the streets was to shoot them in the streets. And people started getting really angry about that because their pets were being killed. And so the shelter was created to move dogs to a place to be able to hold them for 3 days to see if an owner would come get them before they were shot. And so it's kind of mind-boggling to think that 120 years later, we're still operating under the same premise of generally a 3-day mandatory stray hold. And if the owner can't find the shelter or pay to get the animal out of the shelter or come during open hours during those 3 days, then the animal can be disposed of however the shelter provides for. So in America, that can be mass euthanasia, that can be through adoption. In Austin, we've enacted a lot of laws to make sure that animals don't die in shelters, but we are not the norm, especially in the southern part of the United States. So these are pretty big problems. So we recognize all of this as sort of the backdrop for the Human Animal Support Services project. And as we're working through all this, we're recognizing we actually know a lot more that can inform our decisions, and we can modernize what we're doing. One of those statistics is that 90% of pet owners value pets as much as their human family members. That's pretty staggering. And it doesn't match how we treat animals in shelters, knowing that most companion animals are pets. And 92% of loose dogs are owned. There was a study done last year in San Antonio where loose dogs were followed throughout the city for a number of weeks. And at night, between 87 and 96% of dogs go home every night. And that's also pretty staggering. I think people, especially in communities like San Antonio, where there's huge roaming dog populations, that think that those dogs are feral, abandoned, but they're actually not. They have a home. And there's a study in Dallas that is hopefully going to be published soon, but they're finding that over 75% of the dogs that have been reclaimed are actually were originally found within 1 mile of their home, and over half of those were found within 1 block of their home. And so when we think about what we're doing, where we're taking those dogs all the way across a major metropolitan city like Dallas, and we wonder why more people aren't finding their dogs, I think we need to start thinking of other solutions. And a few studies done in Austin were around the supply and demand of adoptable pets, of shelter animals. And in Austin, at least, there's at least a 5-time demand over the supply of rescue and sheltered animals that are up for adoption. And then lastly, accessibility and finances drive pet and family separation. And so all of these data points, we know that from the data software that the different software companies have pulled. And so we're envisioning that there is a better future, that we can do this better. And we believe that unnecessary family separation, unnecessary pet institutionalization, and unnecessary death must stop being used for companion animals in the name of population control and public safety. And so why right now? And COVID is a big driver of that. COVID made it impossible to house large numbers of animals together because that requires large numbers of people to be together, to volunteer, to even just do the staff caretaking. Adopters, fosters, everybody congregating around a shelter is a really bad idea right now with COVID. We know that there is a housing and financial crisis about to happen, and with that, or happening, I should say. And with that, and thinking about that past slide of understanding that finances and accessibility are primary drivers of pet separation and owner surrenders, we can expect there to be a large increase in the number of animals and people needing help during COVID. And we have a heightened awareness of the social justice movement through the social justice movement right now, of the ways that institutions have created the sort of systemic inequity, and where animal welfare and especially government animal services are absolutely part of that. And just with the example I just shared with rabies, that is that's an example of setting up a system where not everybody will have equal opportunity to get their animal out of the shelter. It depended on pay and the ability to react in time and to show up during regular work hours. And so what we're trying to solve, the HOS project will solve problems by doing pretty much this is a massive undertaking. And what we're doing is through, and we'll talk about all the people involved in this in a minute, but what we're trying to do is deconstruct every fiber of animal sheltering and really understand why we do the things that we do, and then rebuild the pieces that make sense and add new pieces and take away the ones that don't make any sense, so that we can have the animal services of the future that actually serves the true need of the public. And we're doing that by marrying the shelters that are doing the work. So having the boots on the ground be an integral piece of this project is critically important. And then also inviting people from all industries to join. So people that are financial analysts and data nerds and researchers to come and help really add the brain power to do that, to deconstruct and rebuild the shelter system the way it needs to be. And one of the fallacies that are one of the problems that we have in animal sheltering and animal welfare in general is that we have a lot of things that we believe are true and we'd probably stake our life on. And that even is in veterinary medicine. And but we need to be constantly striving to use data instead of beliefs and question everything and really try to understand what are real beliefs based on data and which ones are based on emotional or personal experiences. And then the fourth way that we're solving problems is by building a policy and decision-making framework for all governments to use. So trying to create some standardization and consistency across the industry so that governments have a place to look. Right now, they don't. And so they can compare themselves to other cities, but typically cities are just winging it. And so there's really no collaborative resource to look at to understand what the whole industry is doing and what is considered innovative and how cities can really be excellent at the work that they're doing. And so when the project's over, we hope that shelters will be able to reinvent themselves by decentralizing their services. So people are not coming into the shelter, animals are not coming into the shelter, that the services that are generally provided in the shelter are actually going out into the community and being offered there with community members. And the shelter itself becomes a place that is a shelter in the true sense of the word, so that the animals that cannot stay in the places that they live for real reasons can come to the shelter and use it for those real reasons. And I say real reasons because the shelter is sort of a dumping ground of every problem for people and animals together. And there's no rhyme or reason typically to shelter admittance. And so having a real decision-making framework of who comes in and when is incredibly important. And then implementing evidence-based programs, which we don't have a lot of. If the two research projects that I mentioned, or three, about supply and demand and about the number of animals that are found close to their home and the ones, the loose dogs in San Antonio, all of those research projects were done in the last 2 years. And we don't have any data before that to help us make decisions. So we know that there's a lot of evidence that we need to collect to start building the right programming. So who is working on the HOS project? We have a lot of people involved, and we have some incredible funders that are making this possible. If you think about what it would have taken pre-COVID to re-engineer animal sheltering, it would have been hundreds of millions of dollars. And I think that's one of the reasons why it hasn't happened, is that it seems unachievable. But because of COVID and because shelters were able to empty out and send most of their animals to fosters, all of a sudden we had this space where we could rethink what we're doing and we could come together and collaborate. And that space wouldn't have been provided without COVID. So the funding that is going into this project is really just about facilitation and administration and support, not about making shelters do anything, which you would expect pre-COVID, where you go in and you actually do it with shelters. We don't have the funding for that. Nobody's ever going to have the funding for that, and so we're able to do this as all of us driving this forward. We have 36 working groups that are built from people from all walks of life, with over 500 individual collaborators, and those people are helping to solve big problems within the shelter industry. So each working group is tackling one big problem. And those problems range from lost and found. Why are so many animals coming into shelters and so few being reclaimed? A big problem around transforming to be foster centric. That is a stumbling block for a lot of shelters because it's hard. It's hard to work with people it's so much easier to work with animals in a kennel than it is to work with people who are caring for those animals in the community. So it takes a different support system, and we need to build that. And problems like budgeting. There is no standardization around government budgeting for animal shelters. So again, most shelters are winging it, and we could be doing so much better. And a lot of governments are expecting shelters to save all the lives, have zero complaints coming from the community, make sure there's no roaming dogs on the street, and typically not giving enough funding, and not even knowing that they're not giving enough funding to be able to do that. So there's a lot of problems that we need to solve. And we are doing that with 38 pilot shelters that are showed here on the map. And it's even extending internationally into Canada and Australia, which we're really excited about. The Australia group is part of the working groups, not part of the pilot shelters, but they're really excited to be part of this. And so what does success look like? That's a question we get a lot of, because a lot of this is about the project itself, where we're doing the work to imagine and to collect the evidence. But there are some success measures that we know are important. And one is benchmarking. We like I mentioned a few minutes ago, we use what other cities are doing to determine what we should be doing. And we've never asked the community what we should be doing, what citizens believe, what is the public will that that people believe government should be providing for animals and people together. And so we are creating a benchmark system where we can ask people, and we can do that through a variety of ways over time, including surveying and focus groups and repeat surveying, and actually working in the communities and getting firsthand information, working through human agencies to develop a master list of benchmarks that then we can use in each community. It'd be amazing if they all match community to community, but if they don't, then have a system where every community can get those benchmarks, and then use those to say, okay, this is what the community believes. Is our budgeting in line with that? Are our policies in line with that? Are our outcomes in line with that? And pretty soon we can have a much better framework for matching what the community as a whole believes and what we're offering as animal services. And I have this little, I wanted to show you this video because I think it does a good job. I'm going to escape so I can click on this. I think I can click on this. Sorry about that. Let me put it over here.
And then you'll just need to switch to share YouTube. Because right now we're still on your PowerPoint.
Oh, shoot. Okay, hang on one second then. Thank you for pointing that out. New share. All right, can you see that?
Yes.
Great. All right, let me go back to the presentation. Okay, so what we're hoping is that we can use those benchmarks to achieve success, but also have these key elements. There are a number of key elements that we've identified that are part of that success. And what I mean by that is that it's really easy to say, for a shelter to say, oh, we're doing the Haas model. And you've probably experienced that with other fill in the blank models. And what we really want to do is help communities and help animal services understand what that really means and what the key components of those of that model is. And so we have a whole bunch of elements, and I'm going to run through them really quickly just to kind of give a picture of what these look like. And so looking at and I should say there's benchmarks that are what the community expects, the public will, and then there's smaller benchmarks that would be used to help communities measure their success, measure their performance, and share that with their community so that there is transparency, and there's an ability for the community to help drive this, and for volunteers to help drive it, and for the animal services leadership and government leadership to be able to drive it. So first element is lost and found. The organization operates a comprehensive lost pet reunification service to successfully get most roaming pets home without them having to enter the shelter system. So if you think back to that statistic of 75% of the animals that were coming into the Dallas animal shelter that were reunited with their owners, so we knew where the animal lived eventually, that they were found within a mile of their home. How do we need to change how lost animals or found animals are reunited with their owners? Taking them to a shelter doesn't make sense anymore. So how do we start creating the system out in the field? And this is an example from El Paso that a community member found this dog, and they reached out to animal services, and animal services was able to help them help to find the owner and also to keep the dog in their home in the community. So probably within a block or a mile of wherever this dog lives. And that by doing that, they have a much more likely chance of reunification. And the shelters piece of that is providing the resources to make that possible for that finder. The next element is intake to placement. So pets that physically enter the shelter have an outcome pathway identified before or at the time of intake. So the in-shelter length of stay is drastically reduced. One of the issues that we've faced in Austin with really trying to achieve the no-kill work is that every type of animal has a different length of stay. And so our traditional measures of success, looking at the length of stay of all animals, so you know, a lot of them are 2 weeks, that your average length of stay should be 2 weeks. And that doesn't work for every animal. Some really need to be out of there same day. Some need to have a lot longer, have more time for more people to see them if they have to come into the shelter to begin with. And those might be incontinent cats or animals that are like a pregnant mom and babies, pregnant mom who has babies. That length of stay is going to be very long in a foster home. And so trying to squeeze that length of stay into the short 2 weeks doesn't make sense. So developing a full set of best practices, if you will, for getting an animal in and out of the shelter, if it has to come in to begin with, will be incredibly helpful for our industry. Another element is keeping families together. Pet owners can access pet support services, including housing, medical, and behavioral support, and food and supplies. And this is all in an effort to keep the human-animal family together. And we recognize that there's a lot of animals that are surrendered to shelters where the people actually want them, but they feel like they have no other alternative. And so we can start trying to deconstruct that and figure out all the reasons why people are doing that. The shelter software typically picks up on the main reason, like housing or finances. But by doing a deeper dig, we can actually find out more about the specific situations and look at how many of those people actually want to keep the pet versus don't want to keep the pet. And that's not something that our software can currently give us a report on. So we'll be looking at trying to actually augment software to be able to collect more information like that. So we can set a goal of keeping those pets with those families where people actually want them and it's appropriate to do so. And many of the shelters, this is El Paso again, many of the shelters the tier shelters are now offering services as drive-through or walk-up services out in the open to avoid COVID, but to allow pet owners to have what they need to keep their pet, especially during these hard times. And we're working on an external-facing medical care working group solution to try to provide more support to the community where people don't have access to care. The veterinary industry is now really putting more statistics in place on how many people are not utilizing regular veterinary care because they can't access it for one reason or another. It might be transportation, it might be finances, but having the shelters involved in that, I think, is part of the solution that we're looking for, is in true partnership with veterinary practices so that there's not an infringement of business, but there's actually a collaborative increase in the services that can be offered in every community. The next element is the shelter. So the core functions of the physical shelter are to provide emergency medical care and short-term housing for pets with urgent needs and to ensure public safety and public health priorities are met. So this starts to narrow down what the actual kennels in a shelter are used for. And one of the benchmarks we might look at is the number of animals that are housed in the shelter that are owned. And this is an example from Pima County where this person went to substance abuse treatment. And in that situation, he would have had to surrender his dog. And this shelter was able to find a space to keep the dog for the 30 days that the man was seeking treatment so that he could reclaim his dog. And that is a more appropriate use of the word shelter. And I think we're going to be seeing a lot more of that, which is really exciting. Another element is self-rehoming. A lot of the animals, so if you think about the people who are surrendering animals that don't want their pet anymore, that is this group of animals that are always going to need to be rehomed. And so we can use a shelter kennel for that, but that's kind of a waste of time when most rehoming is, and space, when most rehoming is now done virtually. meaning that we're posting all of our adoptable animals on our website. We're getting a lot of our applications online. We're doing first interviews remotely. There is a lot that's happening virtually that doesn't need brick and mortar anymore to accomplish the goal of rehoming. So having a place to do that, and then measuring benchmarks around the usage of shelter kennels, trying to reduce that as much as possible. There are always going to be people that need to rehome, want to rehome, and don't have the luxury of housing the animal while they're rehoming. And so it'll never be zero, but I think we can be striving for a better system. And there are several platforms out there. Adopt a Pet Rehome has one, and there's one called Home to Home. And they provide the online virtual service to be able to, for people to be able to rehome their own pets. A lot of the tier shelters and shelters outside even of the tiers are having a hand-holding staff person, so a person who can walk people through the process and help them with the meeting adopters and reviewing applications, so that it's not as scary. And we're adding an element of trust. I think that's one of the reasons why maybe more people don't do self-rehoming, is that people are worried about, oh, if you see an animal on Craigslist, or an adopter comes forward on Craigslist, it must be somebody bad. But we have a lot of ways to be able to start trying to really understand who's adopting and who's rehoming, and matching those together in appropriate ways. Another element is field services and public safety. So animal control and field services protect public health and safety, enforce animal cruelty and neglect laws, and aim to address the root causes of animal problems. So thinking about what the last speaker was talking about, this is where our animal officers should be pointed, is really helping animals that are in real need of help, not necessarily solving nuisance complaints and the picking up stray dogs. And there needs to be a way to handle those things, but kind of like what we're seeing with the police reform, we need to make sure that we're using the resources for enforcement in the right way, and trying to narrow down what those ways are, and how do we then provide more resources to people so that we don't get into that situation to begin with. And so a lot of the things that we can be doing in the field may not be animal control officer related, but actually expanding that so that we have volunteers that are offering field services like fence support, and delivering food, and helping to mediate a conflict between neighbors, and really just expanding what we mean by field services, and then having a specific focus on public and animal safety. And this is an example out of Guilford County in North Carolina, where the officers are now, and volunteers are now, going to houses in plain clothes, not using uniforms, and talking to people about their problems and helping to find solutions. So really trying to break down the barriers that prevent people from even answering the door when an officer shows up in a uniform and may be trying to help, but is scary and off-putting. So the next element is telehealth, offering remote telehealth and telehelp services. This and telemedicine is different than telehealth, but just offering people advice on when to go to a vet clinic, or what they can find at home for, feeding baby kittens. Those kind of things fall into telehealth. Telehelp might be things like where to find low-cost fencing supplies, or how to get in touch with a foster directly to help keep an animal out of a shelter. And then we animal shelters typically are kind of back in the 1980s with technology, and so really trying to embrace the technology that exists for other for-profit businesses with online chat, and having kind of the 24/7 resources available, with resources on their websites, frequently asked questions, Facebook pages where people can connect together. There's a lot that we could be doing better than what we're doing. And one of the examples is this, I think it's called the Lost 2 with the number 2 found service, where there's a texting service that people can text if they've lost their pet, and they'll get updates for every dog that enters the shelter is reported to the shelter as found, or every cat if they've lost a cat, and also point them to resources about how to find their animal, how to post signs, where to look, all of the things that we as animal welfare people know, but the general public doesn't. Next element is case management. So animal services personnel are trained and start to serve as case managers, and this does include social work and helping people keep their pets, providing resources and support through crisis. And this is a skill set we have not really honed, but it's becoming more and more popular, thank goodness, and there are more and more resources available. I know that you guys in Canada and Ontario are doing amazing work through the university, and we're really excited to see this kind of explode into the animal welfare, animal sheltering space, and really provide a lot more help, trained help, to owners that need it. And we haven't even done a good job of breaking down why animals are coming in and why people are reaching out to us, to shelters to begin with. And so we have a lot of work to do to even understand all the requests that are coming in, so that we can build the appropriate triage system to handle those concerns and have case management available for every case that needs follow-up support. Another element is foster. The majority of pets that do need to enter the shelter system or do need to be rehomed are put into foster homes immediately. And one of the ways we're seeing that emerge right away is through this program called Dog and Dash. This is all over Texas. I don't know if it's everywhere else, but basically as fast as the animals come into the shelter, they are being, cars of foster parents are lined up, and the animals are put into their cars with information about how to foster. And of course, these are not necessarily behavior dogs or cats, but animals that can quickly be turned around and moved from their original home to a foster home, and then wait for their adoptive home in that foster home. Another element is partnerships, working with human social services agencies, public health, veterinary practices, rescue groups, and other community partners to work with people and animals and preserve that family unit. We tend to be very siloed, which you probably know, and we have an opportunity to work together in animal welfare, but also outside of animal welfare. That first slide that had the data points of knowing that people view their pets as family members, yet our public and human services don't necessarily support animals in that family unit. And so how do we bring it all, how do we create that wraparound service that is inclusive of the human needs and the animal needs? And that's going to take a lot of work, but I think that now is the time. We've never been at a better place for animals to be part of family and be considered part of family by governments and communities alike. And so this is out of Guilford County. They've partnered with Meals on Wheels to develop a pet food supplies program. They delivered in 1 month 800 pounds of supplies to homebound seniors, and in October already added 5 additional seniors to their delivery list with multiple pets. They're also working out of a local church and establishing a pet resource office in a local community to help with food, supplies, spay, neuter, and humane education. So really trying to just extend the walls of the shelter, getting actually using brick and mortar that already exists in communities, rather than trying to drive everybody to the brick and mortar shelter that's in one part of town. The next element is community and volunteer driven. The community is such a big piece of this, and we know that because the public will is what governments are trying to be serving. And for some reason, and I'm sure this occurs in other government departments, but for some reason in animal services, we have a divide between what the community believes overall and how the animal services operates. And I think that has caused a lot of conflict, that divide, because the community wants to know. They want to know that animals are taken care of. They want to know that that animals aren't unnecessarily separated. They want to know that animals aren't necessarily losing their lives in shelters. And because of that divide, the community really doesn't have a way to transparently see what's happening in shelters so that they can support that and actually drive for more changes, like budgeting increases. And we need to connect those dots, because we know one of the big drivers of government action is public outcry. And so how do we bring everybody under the tent and we all have outcry together, for lack of a better word, where we're driving progress, because that's the right thing to do as a whole, not one against the other. And this is just a picture of, in the past, most community members are left with having to file for public records rather than just having open communication with their government. And so we have an opportunity to fix that. And I'm really excited about that, because I think that's going to help in all aspects. Another element is COVID and crisis response. We talked about why this is needed and why government, if you think about where we were in March when this all happened, we don't have a way to expand our services. There's no lever that we can pull that says, okay, we need to be able to serve a whole lot more people all of a sudden, and we need to do this in a way that doesn't spread disease. And we know that from an animal point of view, that we need to stop spreading disease, but now it affected people, and we have an opportunity to use that to help prevent spread of disease for animals in the future as well. And so by creating the Haas model and decentralizing services and using foster homes, we can expand the number of animals that we're serving and people we're serving, because it's not dependent on a number of cages. And that changes everything. The element innovate the field, we're almost finished with the elements. The element innovate the field is really important, because like I said, we're kind of stuck in maybe the 1980s or 90s. And we have an opportunity to really change the way that we train our people, that we have our basic job training. There's really none. And we're finding, as we're talking across so many shelters, that that's the norm, is there's no training, that people are just thrown in. And that's what happens when you're overwhelmed, you're under budgeted, and there's not an easy way to provide that training and professionalization. And so we really need to think about that. How do we elevate this field to a place where it's important for the people handling animals and people to have the training that they need to do a good job at it? And then IT modernization, that's a no-brainer. We need a lot of help in the IT department so that we can solve more problems. Government support is huge. Right now, across the board, it is sort of unanimous that government officials, whether they're elected or at the highest level of government, typically don't want to know anything more than the not hearing about animal services. And I don't say that in a bad way. They have a lot on their plate, but we need to figure out how to help the government understand that this is a priority for their community and their citizens. And I think we'll be able to do that through the benchmarking that we're doing, but also to help them understand how the decisions that they're making affects what the community expects and wants, and how we can marry those two things and come up with budgeting practices, benchmarking for, like I said, policies and all sorts of things that can help make decisions without them having to become experts or try to understand from special interest groups or the loudest complainers what's actually happening in their community. And then I think this may be the last element, but equity and inclusion. We know this is hugely important for every field out there, and we're no exception. Animal welfare is not very diverse, and it comes across in our adoption policies and our hiring practices and everything that we do. And so we have the ability to change that, and we need to make sure that every bit of the Haas model is infused with equity and inclusion, and a real concentrated effort to make sure that we're building a more diverse, inclusive animal welfare field. I lied, I think this is the last one, is evidence-based. So using data and research to inform our practices, change laws, and help people. The veterinary profession has gone through this transformation from more anecdotal basis to evidence-based, and the animal welfare industry needs to do the same thing. So collecting, a lot of the evidence isn't there yet. And so we need to collect it. We need to focus on collecting it, and then try to make sense of it, and then put it into action. And I think that's it. I know you guys may have some questions, so I will I'll let Steph take over my screen, but if you want to get involved, go to our website. We'd love to have more people join our working groups and really be part of this movement, because there's an awful lot that we need to do, and it's going to take all of us pushing this forward.
Thank you so much. That was an amazing talk, and we do have some questions for you. So let me figure out which one is best to ask to start.
Okay.
So the first question is, if shelters want to embrace this model, how would you suggest they start?
I think the first place to start is in the conversation. So we have a Monday morning phone call that is at 10 o'clock Central Time every morning. It's on it should be, it may not be on the website, but if you go to our Facebook page, the American Pets Alive Facebook page, you'll be able to see it there. And we have another call. So that's for all shelter staff and actually any animal welfare staff or volunteer. And then on Friday mornings at 10 o'clock Central Time, we have a similar call, national call for leadership, animal welfare leadership. And that is, both of those are designed to have conversations with each other and really start this collaboration process, hear what each other are doing, share resources, and hear from experts with quick little snippets of information that we all need that is impossible to get out there otherwise. And so that's probably the best place to start. And then, you know, joining a working group, if you have the time, they're generally an hour a week, and tackle one of the big problems. And you can find the working groups on the Human Animal Support Services website, which I shared the link for just right before this.
Thank you. So how do you deal with people concerned that shelters are empty? How do you explain to people that it's actually a good thing?
You know, that's really difficult. And part of the reason that's difficult is because of that siloing of community, what the community thinks and wants siloed away from what the government is doing. And so we need to broaden our communication and help everybody be in the loop on what's going on and why decisions are being made the way they are and what evidence we're looking at, and just how this is all unfolding. And that's really hard because there's not most government shelters are not funded for somebody to do all their marketing and to talk to the community directly about these things. And so finding time is one of the big drivers for that siloing. But also, you know, I think that the public, it's hard to even share information with the public because we don't have statistics that we can pull from our software. Our software doesn't collect what activities are happening in the community that are preventing the animals from coming in. So what it looks like when you share statistics, it looks like a massive decrease in intake. And if I were just an average community member, I'd be like, that's weird. I guess they don't need all the money they've got anymore. But what we really need to be able to report on is, and honestly differentiate between agencies that are doing nothing more than closing their doors and agencies that are doing robust activities out in the community and helping their community and really putting the resources out there. We need a way to collect that information and report on it. Right now, most of the shelters that are doing it are keeping spreadsheets and trying to share the number of touches they're having in the community. That, you know, you saw in the Guilford County slide how many pounds of food they're giving out. And we just need a much better way to collect the information that's happening throughout the entire breadth of human animal support services, not just animal sheltering, which is really about intake, care, and outcome.
That's great. So what is your opinion on a sustainable method of income generation to be used for veterinary care grants, i.e. shelter, thrift shop, or anything else that you could think of?
Yeah, so fundraising is one of the working groups because we recognize that's an issue, and fundraising is different than government budgeting. There's two folds to this. One is we need to make sure that that agencies are appropriately funded for what the community expects them to do, and then fundraise for the rest. So anything that's on top of that should be fundraised for. And how do we do that? Again, most government agencies don't have a fundraising team member. They're not allocated that in their budget. And so that's something that we can change. If governments are expecting their government agency to fundraise, which a lot of them are, then there needs to be a person or a team that does that in the staff. If for private organizations that like ours, like Austin Pets Alive, all we do is fundraising. We don't have any government funding. And that is through our thrift store. Thrift stores are a great source of revenue, and I'm happy to share anything that our thrift stores are doing if people want to contact me. And then another way is crowdsourcing for the external facing medical care working group that Dr. Jacobson is on with me. I saw her in the chat, so I know she's here. And she's the one that invited me here, actually. And we're recognizing that there's different pipelines of funding that need to go to that. And so there may be some government funds that go to that, and then maybe for some conditions, and then other conditions are fundraised for. And that could look like grants, that could look like individual donors, corporate funding. We're working with Align Care in out of Tennessee with Dr. Blackwell, and really trying to help create an Align Care system, which is basically social like Medicare almost for pets for people within a narrowly defined demographic. And so those animals would then be eligible for this corporate funded support. And we're also hoping to start elevating some of the virtual platforms that are out there where people can directly connect to animals and people in need of medical care. There's something very motivating and inspiring for donors to be able to see the exact animal that they're affecting. And so we're really trying to narrow that, help that become more of a reality. There's platforms that already exist, and how do we make those more well known? What is missing that we need to build to connect people who want to help with those that need the help? So there's a lot to do. And if you're really interested in that, the fundraising work group is a great place to be part of that brainstorming team and help to build the toolkit that hopefully we can distribute whenever it gets done in the next few months.
Wonderful. And so if anyone has more questions, please post them either in the chat or the Q&A. So the last one I have submitted here is, how do you deal with control issues? For example, self-rehoming, adopt from foster, that kind of thing.
Yeah, that is, I think that's a hot topic of conversation, and both from the people who want to maintain a lot of control and people who think that we should have a lot less control. And control is probably not the right word. It's more of the gatekeeping. I think that my hope is, and we have an adoption working group and an industry engagement working group. And the adoption working group is really trying to look at what is the local demand for pets and how do we make sure that we're filling it. And maybe it doesn't matter. Maybe it doesn't matter if one rescue group has adoption policies that are different than another. Maybe it doesn't matter if there's that much demand and no animals are dying in the community because there's not a, quote unquote, not enough homes, then maybe it doesn't matter at all. Where I think that it comes into play is in our relationships and collaboration. And we're seeing that open adoptions is probably the biggest place of conflict within our field right now, that we're seeing through the collaborative spaces that we've created. That's where people seem to be really rubbing against each other in the wrong way. And so the industry engagement working group is charged with bringing all sides together and having these conversations. Where's the line? Where's the line on control? Where's the line on safety? What kind of home isn't acceptable? We need to define those things, and we don't currently have a way to do that. It's just sort of this open adoption versus heavily managed adoptions, and we need to add more meat to that conversation so that we can actually understand where the philosophies might differ and where we create pathways for everybody to at least be respectful of each other and move together in a productive way. Not sure I really answered that. We're sort of working on all of it.
Thank you so much, Ellen. This has been wonderful and we have learned so much. And I do look forward to, I'm going to join some of those calls so I can learn more. And I'm sure other people on the call are also going to join them. Your calls may end up quite busy after today. Thank you so much for taking the time to speak with us, and we really appreciate it. And just thank you so much for your time.
Thank you so much for having me. I really appreciate it. And I just really appreciate that you're providing this platform for everybody to talk together. Thank you.
Thank you.
Okay, hello everyone. Thank you for joining us for the afternoon sessions of Thinking Out of the Shelter, Taking Animal Care into the Community. My name is Shalini Ramsabeek, and Stephanie Black will also be helping in hosting these afternoon sessions. If you have any questions, please enter it into the chat box, and at the end of the sessions, I will ask the questions on your behalf. Thank you to all the sponsors, OVC, Pet Trust, VCA Animal Hospitals, Hills, Vet Purchasing, Benson, and Ogina Solutions. This day would not be possible without their generosity. Well, the first topic of the afternoon is using telemedicine to expand accessible veterinary care to remote and socially excluded pet owners. It will be presented by Phil Nichols. Phil Nichols is the Chief Operating Officer at the Toronto Humane Society, and he's also the President of the Ontario Association of Veterinary Technicians. He became a registered veterinary technician through Seneca College in 2010 and obtained his American Animal Welfare Association certification in 2017. Phil has played a fundamental role in the transformation of the Toronto Humane Society over the past decade, and plays key leadership role in its public veterinary services division. So I'll now hand you over to Phil. And Phil, I think you just have to unmute yourself and let me know if you're having any difficulty with that.
Hi, Shalini. Yes, thank you. Thank you for the kind introduction. I lost the little window. It moved over to the screen share. So I think if everybody can hear me now, it should be good to go.
Yep, perfect.
Awesome. All right. Well, thank you, everybody, for attending today. It's a great presentation being put on by the OSMA and a wonderful CE day. So I think that's really positive. It's been a great morning so far, and I feel, quite frankly, a little below the bar in all of these wonderful talks that came ahead of me today. So please excuse the lack of pictures, and it's a presentation predominantly with text. And getting into the conversation, I just want to start off by saying I'm not going to be talking today about how to effectively implement telemedicine and the challenges that we've experienced directly on the calls. I wouldn't be the best person to talk to you about those topics or those aspects, although I do think we have a number of our staff in attendance today that have been present and taking part in those activities, and they would be far better suited to answer those questions. What I do want to talk about is utilizing telemedicine to expand accessible veterinary care and the capacity that we have to utilize the tool and just get it on everybody's radar. I think it's really important for us to maintain the conversation and keep up to date with new and potentially innovative and inventive ways to continue to overcome those barriers. Certainly what we've been doing for years isn't really hitting the mark, and it's not getting us ahead of the game and moving that. So wanting to keep that going. The question of why telemedicine and where did that come from, and how did Toronto Humane Society come to this? And I think in a large way, a lot of it was driven by the pandemic. And I'd say it's one of those silver linings that kind of came to us with that. But the real reasons that we want to utilize that and look at it as a potential tool, and in addition to our toolbox there, is we truly believe that overcoming the barriers of access to care is one of the greatest steps as an organization that we can take. And we need to tackle the root causes of animal relinquishment and poor welfare, and not remain reactionary with our programs and services as a humane society and an organization. And I think ourselves, like many other agencies and organizations in the industry, have found themselves often relying predominantly on those reactionary type programs. I think it's important as we're moving forward and understanding what a barrier to access to care is. And there's been some wonderful talks throughout the day, so I'm not going to stand on this too much, but understanding accessibility and common language. I think it's important to understand that it's not just about ease of access from a location standpoint or for somebody's ability to make it to a physical location. And if we look at the definitions of what accessible could mean, is capable of being reached, easy to speak to or deal with, capable of being used or seen, capable of being understood or appreciated, capable of being influenced, easily used or accessed by people with disabilities. And I think we really need to incorporate all of those understandings when we're looking at overcoming barriers to access, because there's many different ways that we can work forward and do that. Touching briefly, in this more of a Canadian look, but why is accessible care needed? And again, preaching to the choir likely with those in attendance today. But I think it's always important just to put a touch point and talk on this and think about this. And if we look at data from 2008 through to 2019, you can see there's been a gap growth of around 20% of those pets that don't have access to care or are not engaged in a current veterinary client-patient relationship. And we can see that based on statistics of the animal population in Canada, as well as looking at the annual reports coming out of the provincial colleges, economic surveys, and other publications. When we're looking at the reasons of why accessible care isn't needed, we've been, as an organization, looking a lot at the access of veterinary care barriers, current practices, and public policy report that was put out. And in figure 5.14 from that study, we've seen what a lot of those reasons are, subdivided into the different reasons of preventative care, sick care, and emergency care. The predominant one clearly is affordability. But if we look at how people get to places, didn't have a way to get there, they were concerned the provider may think badly of them, putting themselves into that environment where they have to go into a clinic and be worried about judgment and that sort of thing. Or they didn't have a leash or a pet carrier. And I think telemedicine can help us cover off a lot of those different pieces. So again, back to that why telemedicine and why are we thinking about this? And telemedicine presents opportunities to tackle two of those main concerns, as we saw in that last slide, and the predominant one being affordability. And I think significant opportunities exist for services to be provided with lower operating expenses than in-person care. And it's not to say that we want to stop in-person care. That needs to be a part of it. But when you're looking at operating overhead and your expenditures, it's easier to do telemedicine with lower operating overhead, especially if it's a complementary service to other physical services that you may be running out of your location. And in accessibility of a physical location, we can extend access to the client's location without the needed investments required for travel. And that's both from the client perspective as well as the service provider perspective. When we're talking about what practicing via telemedicine is and what does it mean, the purposes in Ontario, we can look to those standards that are published by the CVO and the College of Veterinarians in Ontario. And I mean, it's on the screen here, but practicing via telemedicine refers to delivering veterinary medicine at a distance using telecommunication technology. It's a method or mode of delivering veterinary medicine using information and communication technologies such as video chat when the veterinarian and animal being treated are in different physical locations. And I think the guide that's been put out by the CVO is a really solid piece of material. And I think it's also important to understand the differences between telemedicine and the overarching term of telehealth. And what we're talking about today is more focused on that telemedicine piece. As I said earlier, the pandemic gave us a lot to think about, and it changed the way in which I think animal shelters and private clinics in our industry, how they operate, how they respond, what they're able to do. And by consequence, it really had an impact on a lot of the clients, pet owners, and communities, and the challenges that they're finding themselves dealing with. Our urgent foster care program at Toronto Humane has certainly seen an uptick in requirements for urgent care fostering and seeing individuals more challenged by homelessness, and seeing that that impact is really concerning. And in March of this year, the college made the decision to not strictly enforce certain provisions of the regulation during the public health emergency. And a part of that was a relaxation on telemedicine prescription of non-controlled drugs, utilizing telemedicine alone in situations where a veterinary client-patient relationship exists. And that is allowable in cases where there's not been an in-person examination conducted of the animal, and where the practicing and attending clinician deems that it is necessary and prudent in their professional judgment. And I'm going to come back to that professional judgment piece and just how I think culturally and philosophically that can pose a bit of a challenge. And it's not something that I think we in the industry are dealing with in isolation. When approaching the question of where to start and how to start in telemedicine, and how to incorporate that as a part of your practice or a part of your programs and services, and how those things move forward, we can reference to a piece that was put out by the OVMA, and some of the information in there, as it is on the screen, is the main thing that we want to do is when starting telemedicine is to understand the client needs and your business needs, and to start small. You don't want to go full tilt, and I think it would be imprudent to do so. Certainly the pandemic forced a lot of people to step very far outside of their comfort zones in order to keep things operating and continuous. And you don't want to offer the service to everyone right away. Start with a particular subset of your clients and expand outwards from there. So drawing back to Toronto Humane Society and what we've experienced over these last 6 months with telemedicine and how we've been working forward, and I'm happy that both Steph and Shalini are here today and are able to speak in case there's any specific questions, because both of them have been instrumental in helping us take part in our small start and getting that out there. But in May of this year, we opened up a shelter outreach telemedicine consultation service. And that's a telemedicine service that's available to other animal welfare agencies within the province of Ontario. And since that launch in May, we've onboarded around 11 agencies who signed on with us to take part in those telemedicine services. And it's been a pretty slow start, which was expected and anticipated, and it's giving us that time to kind of work out the kinks and see how it's going to happen. And we've been able to do this predominantly through the pandemic, and I'd be remiss if I didn't say this, by Purina Pro Plan Veterinary Diets. They've provided a nice program sponsorship and are covering the operating expenditures for us to try to get this program running and get more affordable care to animal welfare agencies. And it's a program that we're very proud of, and I think it's been an assistance to a number of different nonprofit organizations who, like Toronto Humane, also found themselves struggling in the face of the economic challenges that the pandemic has brought with it. And we're trying to use that, again, as a service to primarily address the barriers of affordability and access to veterinarians, specifically for this client base, and those veterinarians that have a greater exposure and experience in shelter medicine, as it is different than standard practice. Secondarily, though, this program has been helping to serve as a pilot to help identify strengths and weaknesses in the system, with an eventual goal for us to be able to engage and implement a more broad rollout of a telemedicine service and program. Clearly, I think it goes without saying, further expansions are dependent on the current state of affairs and the relaxations with the Act being holding true and carrying forward with us in order for the current scope to continue and move forward. And then, I mean, inevitably, we, as everybody would be, you're faced with that question of, is this a service? Is it a program that is going to work at a larger scale? Absent a crystal ball and the ability to see into the future, I think And we think as an organization that will it work? We're not quite sure, but we do think it has a lot of promise. And it doesn't have promise to be a full-fledged solution. It's not going to replace in-person veterinary care, and it certainly can't be utilized as a tool to not provide in-person care and not come up with solutions to still be present and still be able to provide those services. But it could be a great complement to support programs and services that have little capacity to be present and accessible to your client base physically all the time. I know there's a number of presenters that are going to be coming behind me today and talking about programs that they have that are available to get into the communities. We also offer some of those programs and services as well. And I think the biggest challenge that we have, especially when we're looking at more remote areas, is we can't be there all the time. And having a fly-by-night solution that isn't available and accessible to the clients in those areas all the time, or at least more frequently than we are there, is a big hindrance in the scope of programs and services and tools that we currently have available. So the second question we come up is it something that's going to be accepted? And when we're trying to approach the question of will acceptance come in, we do need to, I think, draw a little bit outside of the veterinary sphere, look to other services and other programs and how those pieces have kind of come together. And we know in looking at a 2016 study in Ontario that telemedicine utilization is on the rise, and that utilization rates are highest in traditionally underserved rural areas of our province. And that is based on human medicine services and programs, because certainly telemedicine in the human health sphere has been on the rise and engaged far longer than what we've been experiencing in veterinary medicine. We know from a veterinary specific sphere, the AVMA Practice Advisory Panel looking at telemedicine recognize that there's a growing societal demand for telemedicine in veterinarians, so that we know that our clients within the veterinary sphere are also accepting of this. So I think we can say with relative certainty that yes, it will be accepted. It may take time. And how do we go forward, and how do we overcome that piece? And what should we consider in our approach, which is where we go. And I think it's a nice pathway for everybody to kind of go along and looking at a report, again, coming out of the human sphere at a telehealth forum held in 2018. So we're still dealing with relatively new data, recent data. The implementation challenges that were found in bringing these programs to fruition and making them run. Incentives. So what's the incentive to run the program? I think it's a good one that you need to try to get around. And culture and behavior was an interesting one. And I'd like to talk on that, because I think generally when people are looking at this, it's the culture and behavior of the client base. And like, well, the clients aren't going to be accepting of it. They've become accustomed to kind of the way things are. But the barrier that was actually referred to, and this is a challenge, was the culture and behavior of the service provider systems and the individuals delivering the service and not being readily able and capable of adapting to providing that service in a new way. Fear and distrust in the reliability and ability of the technology, payment for services, regulatory issues, privacy implications, local and more rural clinic capacities that need to take those referral cases, need for the critical mass of users and specialists. That one was very more specific to the human healthcare, and then the sustainability of the program. And I'm not saying all of these are going to be implementation challenges that we are going to face in our own industry, but I think it's something that we need to be aware of as we're trying to figure out how to bring this technology and this service in. Additional challenges I think that we can all appreciate in our own sphere. Our patients can't speak, right? So the same capacity that it exists within human medicine is certainly not going to be as directly applicable, but I think any barrier is just a challenge that we can overcome. And we need to start somewhere, right? And I think it needs to be a part of what we're looking at. So the biggest hurdle and challenges so far, our experience so far, although limited, acceptance of working within new and relatively untested areas of practice, I think is a large hurdle to overcome. It requires individuals approaching this to take a very innovative lens and approach to how case management is kind of addressed. I think Doctors Black and Ramsabik have been instrumental in helping us kind of uncover and look at these things in new and different ways. And I hope they'll both be willing to answer any questions if there's participants that have questions on that specific area. And I do think that we need to keep the conversation going and continually look at and find new and innovative ways to overcome the barriers and hurdles in the way of access to veterinary care. And I think keeping telemedicine on all of our radars is a really important tool, and one that we need to continue to look at and explore. I feel like I kind of ran through that in fairly good time, and I'm coming up to time, so I think I'm just at my questions at this stage, but I'm open for that. Shalini, if we have any.
That was spot on time, Phil. Yes, and so we'll turn to the questions. Let's see if any has popped up yet. So yeah, again, if you've got questions, please feel free to post them in the chat. Okay. Don't see any questions. Oh, okay, so we do have a comment in the chat there, Phil. So I can read it out for you.
Sure.
Okay, I was contacted by the THS about ways they can help. This is one way. Telemedicine for many Indigenous communities would be so helpful. And it's from, this is from Alison Brissett, by the way. We had telemedicine at Kettle and Stony Point First Nation and Walpole Island this year. This could be very, very beneficial for remote communities, including communities like those in Southwestern Ontario. Many people do not have internet services and transportation. Phones are more common, yet there are those without this too. But people help each other. So borrowing a phone is doable. Dr. Shane Bateman would know the challenges of providing telemedicine to Indigenous communities. It's a very insightful comment. Thank you so much, Allison. And just waiting to see if any others. Okay. Payment can be an issue, but if health center, community health reps can be involved, that's sort of a suggestion there. And it looks like we do have two questions that came up. Okay, this is from Craig Mosley, Phil. He comments, great job, Phil. I'm curious how you might overcome access to technologies.
Yeah, and I think that's a great question, Craig. It's not something I think, and I'll go back to Allison's comments there. I think that was very insightful and helpful. I think there's a lot of solutions that are potentially explored there. I think it's also really important that we know that that's not a hurdle that we're trying to overcome ourselves. And given that telemedicine and the human healthcare is an area that we're trying to, the province and other agencies are trying to expand and look at and grow, the fact that it is on the rise is something that we can kind of work with them and try to help overcome those hurdles collectively. It certainly may not be an available solution for all communities, but for those that have the technology and the capacity to engage in it, it's certainly something that we can do for them, and I think something that we should put some work into.
Phil, Craig also had another comment. Given some communities may have limited access to stable internet or equipment, ? And one thought he's considered is the use of a mobile kiosk. Oh, interesting.
Yeah, and I think those from a kiosk standpoint, we can always draw again back to those human healthcare parallels and solutions that they've implemented and looked at. And I think those centralized communication pieces have been a tool utilized in the human healthcare sphere. There is a group working, I think, more specifically within the indigenous communities in Northern Ontario that is driven by the Indigenous groups on helping to deliver telemedicine. And I would really advise everybody to kind of look towards their experiences and what they have found to work to help overcome those pieces. I'll try to post the name of the agency in the chat as well.
That's amazing. Thank you so much, Phil. Like, you gave some really great information on starting. Oh, there's another comment coming through here and a question from Heidi. And hers is, in scaling unrolling of telemedicine services by THS, have you developed a number of priority communities that you are targeting at first instance, and how you're communicating your service to them?
Sorry, Shalini, I was in the middle of grabbing that. If you wouldn't mind repeating it, I just
Sure.
can't see that question.
Yeah, sure thing. So from Heidi, in scaling unrolling of telemedicine services by THS, have you developed a number of priority communities that you are targeting at first instance? And how are you communicating your service to them?
So not at this point in time. We haven't rolled it out to a general client base with that specific purpose. Our first step has been more within industry and utilizing animal welfare agencies, rescue groups, other shelters as our predominant client base. We thought that would be the best place to try to work out a lot of the technical details on how the system could work and have a lot more collaborative ongoing feedback, because a lot of the clients end up being repeat clients, so it can really help us fine tune the systems. What we didn't want to do is bring a program to fruition into general public access that is riddled with a lot of technical problems and challenges, and provide a poor level of service and decrease people's belief or trust in that service as a whole.
And Heidi says, thank you so much. Let's just see if any more questions come through here. And Phil, that looks like that's it. Thank you so much again for your time and all the information that you've provided.
All right, thanks, everybody.
All righty then. So we will move on to the next topic, and this is supporting remote communities during the COVID-19, and it's presented by Christina Burns. Christina is a professor at Georgian College in Aurelia in the veterinary technician and veterinary assistant programs. She has been teaching in this field for 11 years and having opportunities to teach at 3 Ontario colleges. Christina is passionate about bringing the veterinary profession into the community through volunteer and educational opportunities. She is a director of the Community Veterinary Outreach in York Region and vice president and team leader of the Canadian Animal Assistance Team. She's also spent 7 years on the board of directors of our provincial regulatory body, the OAVT, and she's currently developing a chapter of the Community Veterinary Outreach for Simcoe County. Christina looks forward to many future opportunities to connect isolated communities across Canada with the veterinary care they need. And Christina, I'll pass it over to you.
Thanks, Shalini. Can everybody hear me okay, I'm assuming?
Yep, I hear you well.
Perfect. So thank you again for having me here today. It's really great to chat with all of you. I was scrolling through the participants and I recognize a lot of names. So it's really nice to see you virtually / at least know you're there. So today I'm going to speak to supporting remote communities during COVID-19. And really the goal that I'm going to talk about the most is making those connections with the remote communities. Oops, there we go. So of course, Shalini, you introduced me. This is me. You can't see me, which is probably a good thing at the moment, but I am an educator, a lover of animal health, and a dedicated volunteer, and vice president with Canadian Animal Assistance Team. And then I work with Community Vet Outreach, York Region, and Simcoe County, which is coming soon. The association I will talk about today is specifically going to be Canadian Animal Assistance Team. So for information on both of those associations, here are the websites. And with both, if you want to log on to the websites, you can learn all about these 2 organizations. And of course, sign up to be a volunteer if you choose to as well, which of course I highly recommend. So the Canadian Animal Assistance Team is a Canadian-based not-for-profit charity group, and we provide, essentially the goal is to provide animal care and preventive health care to animals in communities that are remote. Most often, like at least I'd say probably 90 to 95% of our clinics are within Canada, and they've been very successful over the years. This organization was established by an RVT in BC, along with a further group of RVTs, as a response to the devastation from Hurricane Katrina back when that occurred. And of course, it's grown over the years to be more focused on supporting preventive vet care for these remote communities rather than as emergency relief. So looking at our overall goals for Canadian Animal Assistance Team, also known as CAT, so if I switch to CAT, I'm not talking about the animal, what we do on a regular basis in a normal non-COVID year, we create field clinics to provide preventive animal health care. And that includes literally, creating from ground up a vet clinic to start spaying and neutering pets, providing vaccines, dewormers, and some emergent treatment as well. We're working specifically in remote communities across Canada. So of course, our mandate is with remote communities. And we're looking to work with those communities who invite us in. And they're inviting us in because they don't have access to vet care. There are barriers to vet care. Most often, it's a physical distance barrier. So the vet might be anywhere from 4 to 15 to 20-hour drive away, depending where we are within Canada. And we work closely with a lot of Indigenous communities across Canada. And this, of course, is by invitation only. So we don't insert ourselves into communities, but we offer a service. And, if that service is needed to support their pet ownership, then we are open to the invitation. And the overall goal for us is to support community pet ownership and community animals. And while we're there, while we're providing, physical care for the animals, we're also interested in providing education about animal care, because pet ownership and animal care looks very different across the country and depending where you are within the community. The teams that we normally send on these trips involve, anywhere from 9 to 15 or more, and sometimes less, team members. And these team members come from all over Canada. And we even one of our teams periodically will get, American students and individuals from the States too, but that's pretty rare. Generally, they are Canadian-based RVTs, veterinarians, vet assistants. In this particular picture, we have a local vet as well, Nicole Jameson, who is from the Lachlan area, Northwest BC. And then we get members of the community to volunteer with us. And we also get members of the public who are public members of CAT and come with us on these trips because they genuinely enjoy the work that we do. So looking at our teams, normally non-COVID year, 9 to 15 people roughly per team. We drive in, we fly in, we boat in, sometimes we ATV in, depending on where the community is and where we're all coming from. We are heavily involved in the community setup. So like I said, we're creating a ground up vet clinic experience. So a lot of times this means, creating a vet clinic in a recreation center or in a laundromat was one. So all these different opportunities for creating a community-based vet care center that will be there for a few days. We stay in the community and with the community. They're responsible for housing us. So quite often we're staying at people's houses or at local motels from them, so supported by them. We utilize the community members heavily as volunteers to help us with setup, to help us with animal recovery and animal organization. And overall, our teams have really close connections between the volunteers and the community members. So we're really well integrated in the community when we're there. So think about that. Think about what we normally look like. And then, of course, March 2020, everything went to heck because COVID decided to show up on the scene. So we know what our teams normally look like. We know what our goals normally look like. But now we're faced with this whole new era of COVID and everything that subsequently has to shift and pivot because of COVID. So if we look historically, what we are used to doing, field clinics to provide preventive animal health care, well, we can't really do that anymore. because of COVID. We like to go to remote communities across Canada because those are the communities with the greatest barriers to animal care or vet care, sorry. Well, we can't go to remote communities because we know that remote communities, of course, don't have the same access to healthcare. So if we in Southern Ontario bring our, potential non-symptomatic COVID people into these communities, it could be really detrimental for those community members. Invitation into Indigenous communities. Well, we know that, I don't know why my scribbles aren't working so well, but we know that a lot of Indigenous communities, especially remote Indigenous communities, actually had to shut the doors to their community for outsiders because, again, they need to protect their community members, and healthcare is not as easily accessible as it is in Southern Ontario. So those, three roles, key roles, are scratched out because of COVID. And that really shook us. That was a big deal, as it was for everybody who's on this call, I'm certain. And it continues to shake us. But we could still look at things such as support for community pet ownership and community animals, and education about animal care. Looking at our teams, I talked about before, what would our team look like if we were to travel to these remote communities, if it was possible? Do we simply wear masks? What does PPE look like? We know that at this point in time, that's totally unrealistic. We're not going to be sending people into remote communities at this time. So where do we go from here? This is the big question, right? 2020 happened. It's been a wild and crazy year. Coronavirus came on board. We had all these clinics ready to go in 2020. It was going to be a really exciting year. We either had 7 or 9. Of course, I can't quite remember. And we were going to go to Nunavut. We had Nunavik on board. We had a few in BC. We had one in Yukon. We were all really excited to go on these clinics and experience these communities and support these communities. But 2020, everything went to heck. We started thinking about what were we going to do with these 9 clinics? What are our hopes and dreams going to be like for this year? What are our members going to do? And what about those community relationships? Because we certainly don't want to lose our community relationships above all. So, word of the year, which I'm pretty sure Merriam-Webster is going to name this as the word of the year, but pivot. So we had to #pivot in a hurry because we were leaving for a community in BC within a couple of weeks from COVID happening. So things had to change, and we had to change them very, very quickly. So we want to know, in this case, okay, we've identified very quickly we can't go on the first few clinics. And then, of course, subsequently, we can't do any of these clinics this year. Not going to happen. There's no way. It's not safe. So we know what we want to do. We know what the communities want from us, but COVID-19 is the biggest barrier. So what can we still do, or what can we still manage to do for these communities? So what this initiated with us as an association is a massive brainstorming session. And this was like brainstorming on the board level. And then subsequently, we have a really great social media team who put together a lot of our messaging and our ideas for how to maintain a connection with our communities. So in our brainstorming sessions, we looked at how could we support these communities from afar. And remember, we're talking about, Southern Ontario compared to in the middle of Nunavut and the Northwest BC corridor. So we're really talking about afar. How do we support our members and the communities? We canceled 9 communities. What are we going to do to make it up to them? We are feeling this serious guilt. What are the greatest needs that we can support? Can we stay connected to these communities? How can we connect? And then, of course, it kept coming up. What do we do? Like, do we just put everything on hold during COVID? And of course, that's the biggest question. Do we just put everything on hold with COVID? Like, do we just sit stagnant for the year and wait it out? And the answer there was like an overwhelming no. We cannot just sit still and do nothing because, yes, we're in our little Southern Ontario bubble. Maybe we're in our Vancouver bubble. But the reality is there are communities out there who now they're not getting their pets spayed and neutered. Now they're going to be faced with potentially more animals, more mouths to feed, more population, puppies, kittens, et cetera, et cetera. So no, we couldn't just sit stagnant for a huge number of reasons. What can we do? This is what we use to guide us. So the facts about what is going on. So the communities have pets. We know this, they have pets. They do not have access to vet care, or if they do, it's extremely limited. And even with that, if they have access to vet care, and vet care, it is a 2-hour drive away, so it's technically accessible. are people going to want to leave their remote communities to travel to another community to access it? So there's a barrier there. Of course, these communities that we support are going to be faced with challenges, and we can't be there to spay, neuter, vaccinate these animals. So this, of course, is going to mean a greater burden on the communities. More puppies, more kittens, more ferals, more injuries. And of course, we're not just talking about, dog to cat injuries or dog to dog injuries, but we have to look at, one of our goals is talking about education for kid safety around dogs as well. And then, of course, the potential for more disease. So those are all the facts. Those are all the things that guided us in our brainstorming sessions. And then now I'll sort of talk to you about what the heck our plan was and how our plan is working so far. So our plan, number one, once we decided not to, of course, do the clinics, then second part is, yes, we need to stay connected. We cannot sit stagnant during COVID. There are communities out there who need support. So number one part of our plan is to stay connected with the communities, which can be really challenging. I think it was Allison Brissett had just mentioned in her chat that a lot of communities, they may not have access regularly to internet. They may not always have access on their phones. So this is a challenge no matter what, but we decided that we're going to do the best that we can and engage those communities in our social media presence. So we took to our social media committee, and we are using Instagram and Facebook primarily as our platforms, along with Twitter as well. And we put this social media team into full swing. And we came up with this concept of Cat Community Corner. So we created a hashtag. And the goal of Cat Community Corner is to utilize our platform to provide educational material that would be beneficial to communities about animal health and pet care. So our platforms that we used, Instagram, Facebook, and otherwise, directed people back to our blog where we could create a longer informative piece for people to review. So the goal here is to maintain a presence and, of course, remind the communities that we're not just leaving them alone. We promised that we would be there. We had to break that promise. So we're going to help you. We're going to not help you. We're going to support you. And we want to maintain a connection there. And I'll talk more to this, but it was really important too that during this connection phase that we provide information on topics that actually matter to the community. So step one, create Cat Community Corner. Part number two, work with the communities. So we talked, yes, we need to engage the communities. We need to maintain a level of engagement. And me sitting in my Southern Ontario bubble, so technically I'm in Central Ontario, but I'm in a little bubble. I can't pretend to know the topics that would be relevant for the communities in rural Northwest BC, in Yukon, in Nunavut, and Nunavik. So we made it a priority to engage with these communities to develop these pages. So Chris Robinson, who's on this call as well, our executive director, reached out to our community representatives and connected with them directly saying, hey, we want to start Cat Community Corner and we want to know, how can we get this into your community? Could you help us support the engagement so that, it's a reciprocal thing? We're supporting you and then you're supporting us by letting us know how to best reach your community. So we're working with them to share the messaging within their community. Plan, part 3, offer advice on the topics that are valuable to the communities. So this was extremely important because, again, I go back to this bubble that I sit in. I'm sitting in my living room with my dog. It's sunny out. I'm in a house, whatever. This is my life. But again, what I think is valuable and important as a pet owner is going to be very different based in a rural community where they don't have regular access to vet care. So our goal here is to support pet ownership in rural communities that don't have access to regular vet care. Offering advice on common challenges in their community can support longer-term pet ownership and health. So what we did, again, in speaking with the community representatives and the community leaders is to discuss with them, hey, we've started this Cat Community Corner. It's going well, but we want to make sure that we're hitting the nail on the head about the topics that are actually beneficial to your community. So me thinking maybe that people want to learn how to do an at-home grooming session with their dog or trim their dog's nails. Okay, the reality is they don't have nail trimmers. They might not be able to access them, and pet grooming may not be the top priority. So we started talking to these community leaders and these community liaisons, and it very quickly made us realize that Southern Ontario topics do not equal the topics of value for rural communities. So it was really great and really insightful for us as a social media team, because it forced us to reach outside of our norm and remember the communities that we are serving and what would be valuable to them. So the next I'll just take you through. So our hashtag community corner, we encourage our communities that we support, not our communities, but the communities that we support, we encourage them to follow the hashtag on Instagram, Twitter, Facebook, and then it brings them to our webpage. So I'm just going to click play, and it's just a quick little YouTube video that shows you our webpage, and then of course, clicking onto our blog to get to some of these Cat Community Corner topics. So this is our blog, and it's our Cat Community Corner blog, and we're looking at topics like shelters for outdoor dogs, helping kids reduce the risk of dog bites, cold weather, and your dogs. We've got porcupine problems, fishhook frustrations, and then we did do a lot about working with communities for their overpopulation concerns. So I'll pause that there. So working with communities to support, okay, we were not able to be there to spay and neuter. You've had a dog that's having very steadily 2 litters of puppies a year. So because we couldn't be there to help spay and neuter and support that population control, now what? Let's produce some material for you to review or learn about how to care for pregnant dogs, how to care for new kittens, how to support a litter of puppies, etc. Because again, it's looking at supporting people through this challenging time. We can't be there. Oopsies. We can't be there. We certainly wish that we could. So this is a quick view of our Instagram feed. And it's just looking at, again, reminding communities to follow the hashtag Community Corner, which, again, because of connectivity issues and the reality that internet is not available in all parts of Canada, there is going to be a limitation to that. But for those that are available and able to follow the hashtag, they can click into it, they can see the introduction on Instagram, and then of course, link back to our blog to get the full story. And that was Quill. He was one of the dogs from the trips who continuously got porcupine quills. So then that's the other thing too that's really important with this, because again, looking at our working groups, we are registered vet techs, we are veterinarians, and in general, we're coming from a vet med background, right? Like that is the brain that we have. So when we started talking to these community members, a lot of them wanted advice on some of these situations that, down here, we would say get to the vet right away. So it was really interesting for us on the social media team, not only to navigate the types of topics that people wanted to learn about, but also ensuring that our messaging, of course, supported the messaging of the College of Veterinarians of Ontario, that we're ensuring that we're working with the, within the spectrum and our abilities to, of course, uphold the rules, that we can't just openly provide vet medicine advice, et cetera, et cetera. So there's a lot of sensitivities in creating these posts, but they've been really great. And it's been a great way to connect with the communities, both directly through having those conversations with the community leaders, but also through this greater platform of using social media. Oops. So that is essentially it. One day we will get back to normal, but in the meantime, I think it's extremely important that if you are serving a community with support for their animal health care, for their pet needs, et cetera, that we don't forget about supporting those communities during COVID-19. I think it's a time where we're all feeling challenges, we're all feeling barriers to what we would normally do. And of course, we're suffering as well, simply as volunteers, because we genuinely love going on these clinical trips. Like, all of our members love these trips. It's so much fun. You can see the beautiful places that we go. Just looking at the dog in the middle, that's up in Pond Inlet, Nunavut. Like, all of us are deeply saddened not to be able to do these trips, but we have to put our own, sadness and boo-hoos aside a little bit and focus on the reality that these communities are without, and they're going to be without for another year at least. So right now we are looking at plans for 2021. What is that going to look like? Is it just going to be a PPE type year, or are we going to have to continue to reschedule and work forward through this means? But I think that, you know, all of us, it's really important we serve vulnerable communities, that we don't forget about their barriers and their needs. And of course, soon we will run free again. And if you need to get a hold of me, or if you have any questions, you know, definitely you can check out the websites that I had posted at the beginning of this session. But if you want to talk with me about any of these, this is my vet outreach email, but you can send cat stuff there as well. I'm happy to field those conversations.
Wow, thank you so much, Christina. I'm just in awe at your persistence and the innovation and how quickly you pivoted and everything's great illustration there. We have a couple of comments by Allison, also what a moving talk from Allison this morning. I'll read it out to you then. It's okay, so Allison says, I'm not very tech savvy. I cannot share from Instagram to Facebook. I have started to share posts, but are all the articles from Instagram on your Facebook page? That's the first one. Or also on the blog for me to share?
Okay, so you're not on Instagram. So are yes, all of them. So we use a platform called Hootsuite, and that is a social media. So for any of you charities, just a really good tool is Hootsuite. And it's a really great platform where you can post your messaging and it will line it up to go to Instagram, Facebook, and Twitter scheduled ahead. So all at the same time. So yeah, generally anything that's on Instagram is also posted to Facebook, especially with our Cat Community Corner posts. So yes, the answer there is yes. Was there a second part of that question, Shalini?
Also about the blog, is there a blog for her to share?
Yeah, so if you, I'm just going to zip back to the beginning. So if you click on, so Canadian Animal Assistance Team, so that first website there, cat-canada.org, I think it's the next is /blog, but if you click into that website at the top, you'll see in our menu is blog, and you could just click into that blog area and you're welcome to share that blog, the blog link. And that has the extended stories for Cat Community Corner.
Christina, Allison is also echoing that the topics that you did on your community corner was great, because she said she's got lots of fishhook incidences.
Oh, yeah.
Peterborough area with porcupine situations. Yep, I worked there.
Oh, yeah, I bet.
And these topics would be great to share even in Southwestern Ontario. Coyotes are also very present in communities in the Southwestern area. And she did indeed, Allison also stated that the Indigenous love their Facebook to stay connected. And yeah, they're waiting for you guys to come back out there to give some veterinary care.
Oh, nice. That's fantastic. And we know that too. I mean, we've definitely experienced that with Facebook, and in a lot of these remote, especially Indigenous communities, it is like the hub, which is so good as long as your messaging is the right kind of messaging, because, you know, word spreads like wildfire. So the key is, of course, for us trying to ensure that our messaging gets to these local community Facebook pages. So Allison, you know, if you have an in for any communities that you think that this community corner would be helpful for, then we're always, you know, happy to connect, and you're welcome to share as well. We really appreciate that.
Okay. There's a question, another one. How are you utilizing RVTs? I know you touched on that quite a bit. Yeah, how can they help you out once you're able to start back and whatnot?
Yeah, absolutely. So in a regular year, so non-COVID year, then of course RVTs make up a huge component of our volunteer members, and so I'm an RVT as well, and all of our clinics of course have RVTs, and they are utilized for on-site medicine. So the RVTs are responsible for assessing the patients ahead of anesthesia. And then of course we use an injectable only anesthesia protocol. So the RVTs are responsible for maintaining anesthesia, dosaging, drawing up dosage, and then of course monitoring anesthesia during surgery and then recovery. Aside from that as well, RVTs are heavily used for the education component. So actually working with community members, just having general conversations with them about pet care and animal health. But yeah, we use RVTs as you should use RVTs. We use yeah. So if you're an RVT and if you're a vet assistant, if you're, any of those positions and you're interested, then definitely we are interested in having you on board. And then just as a side note too, aside from the actual clinics, we definitely use our members and our volunteers to support all of our association structure. So the social media team is a group of, I believe they're all RVTs in Ontario. Anyways, like all of everything that we do is volunteer based. So if you're interested in helping us, we're always looking for members to help with some of these initiatives.
Amazing. And we do have a question, another one. Is the community leadership able to share the information to the residents if they know that they don't have internet access?
Do you mean that, is there another way? So potentially, so if there was an investment on their part, then they could, with the blog postings, you can print them page by page, because the way we have our blog set up, it's it works that way. So the way it's formatted is you could print it and of course post it in a local community center, which that is a really good idea. And that might actually be something that we want to look into, sort of communicating that to the communities, that if they have a local hub where people are gathering, or at least, pass through once in a while, that's a great idea. But yes, they could print them. If that's what you mean, then that's something for sure.
Christina, Chris, thanks for being here as well. But Christina, she's just told you great job. Thanks for representing CAT so well, getting the information out there and the innovation and whatnot. Dr. Jacobson has also posted a couple links in the chat box to the attendees on Hootsuite and the CAT website.
Perfect.
And then Chris added that you can use Hootsuite themselves to create our posts, but for others to join in, you can go to the site, the blog site, and also through Facebook and Instagram. And yeah, you've just got some comments there about what a fantastic program. Actually, another one here is, to what extent have you encountered linguistic and generational barriers to access in both your pre-COVID and COVID outreach?
Oh, that's a good one. So linguistic, not so much, because what I find, at least in my experiences, the ones that there would be linguistic barriers, what I found is that the community leaders that we're working with, quite often they reduce those barriers. So I'm thinking about Pond Inlet, Nunavut is really up there in Nunavut. It's pretty remote. It's quite remote. And what they did is, of course, they took our materials that posted about us, so what we do, why we're here, and they revamped them into inequity to be accessible for members of the community who, heavily rely on their own language for communication. So I haven't experienced it a lot otherwise, because a lot of times we are relying heavily on the community contacts to sort of reduce those barriers for us. And then there was a second part about generational. Sorry, what was that part?
To what extent are the generational barriers to access in both your pre-COVID and COVID outreach?
I don't quite know what's meant by that, generational barriers. Like, do you mean in regard to an older generation understanding why we're there? Whoever asked that question, is that what you mean?
I suspect that as well. Yes. It seems
Okay.
to be perhaps the seniors. Yeah. Mm-hmm.
Okay. So, I mean, there's definitely, I think that anytime a lot of our work, and we are, as a side note, we're working on some cultural awareness and cultural sensitivity training for our members to enter into Indigenous communities once we're invited in. But I think a lot of our work with these communities, again, is reliant on the communities connecting with us and inviting us in, which then they end up doing the groundwork in getting the community, on the same page with them to understand why we're there. So of course there is intergenerational trauma that has occurred with people coming into communities, and things like taking dogs and that kind of stuff still happens. But there's sensitivities within our organization where we really try to reduce those misconceptions ahead of time by working very closely with the communities. So I haven't had a lot of barriers in that regard, but again, it's because of the groundwork, which is quite extensive, the groundwork that's done ahead of actually putting our feet on the ground in those communities. So again, I haven't experienced a lot of it. I have experienced it where certain people don't want you there, and that is the way it is. However, we work to, always be very much sensitive to the needs of the community and the desires of the community to have us there, as opposed to imposing our own needs and wants for animal population control, et cetera. I hope that explains it. I think it's such a sensitive area, and we do our best to support the community to be the lead on it, so that we're simply there to support rather than intrude and be an intrusive presence.
Thank you so much, Christina. You've offered some really amazing information. And we'll pass over to Dr. Bateman now. I'm sorry I've run a little bit over time there. And I'll actually go ahead and introduce Dr. Bateman. So Dr. Bateman we'll be hearing from the veterinarians now. We've just heard from two very inspiring RVTs. So Dr. Bateman graduated from the Western College of Veterinary Medicine in Saskatoon in 1991, completed a small animal internship and Doctor of Veterinary Science in 1993, a residency in emergency critical care. He's been engaged as an academic in his specialty discipline since 1998. At the Ohio State University and Ontario Veterinary College. Outside of work, he holds leadership roles with the Guelph Humane Society, the Community Veterinary Outreach, and several outreach projects to First Nations communities. He was recently named as the Interim Veterinary Director of the Community Healthcare Partnerships Program, a new initiative founded by an 11 million gift to the OVC in 2019. He's also the Secretary of the Ontario Shelter Medicine Association. And Dr. Bateman will be presenting on planning outreach activities in a pandemic. You're okay to go ahead, Dr.
Sorry, thanks, Shalini. I really appreciate that introduction, and really glad to be sharing some time with all of these wonderful, warm-hearted, caring, and empathic people who are such a wonderful community, and together we're making such an impact, I think, in so many places. So really great to be here. I'll give just a little bit of a background maybe for anybody who may not be aware of some of the initiatives that OVC has been involved with. As Shalini mentioned, last fall, Kim and Stu Lang very graciously and generously provided an amazing gift, the largest gift that the Ontario Veterinary College has received previously, to start the Kim and Stu Lang Community Healthcare Partnership Program. This program will be very focused on providing experiential learning opportunities for student veterinarians to understand more directly the impacts of inadequate and inequitable access to veterinary care in many communities, both urban, rural, Indigenous, and remote northern communities. Our focus will be on ensuring that those students are learning about, being able to have important conversations across culture, learning about the principles of, spectrum of care planning, and that the gold standard that we practice with in a teaching hospital at a university isn't necessarily always real life. And for us as well to ensure that our students are exposed to shelter medicine and are inspired by the work of people who are working in the animal welfare industry to join together with them and to consider supporting those programs in many different ways, potentially even directing their career towards that career path. So it's a incredible program with all kinds of potential. We're certainly just kind of starting the program off at this point in time, and the program is sort of inheriting a lot of the sort of one-off types of activities that I've been involved with over the course of the last 10 years. So I'll talk today a little bit about some of the work that we've been doing in two Indigenous communities in Southwestern Ontario, Kettle and Stony Point, Alison Brazette's home community. So Alison and I have been working together for many years now. She's someone I admire and respect so much and consider a great friend for teaching me so many things about the Indigenous life and communities and their experiences. So we've been doing outreach into Kettle and Stony Point and another community close to it called Walpole Island that's on the St. Clair River. In both communities, there have been, Alison and her work has really, made great inroads in improving animal welfare in those communities. And so when we became involved, our focus was on assisting the community in providing preventive health care. We would essentially take a large number of students and other volunteers into the community and provide mass preventive wellness clinics for a couple of days, seeing 150 to 200 animals in the course of a couple of days. It was a great experience for our students, and our student outreach club has been very heavily involved in organizing those experiences, organizing the volunteers, and liaising with industry to provide a donated product to support that work. We were excitedly planning our usual spring activities this year, and as everyone has been talking about, COVID happened, and we pivoted, as Christina has very eloquently talked about as well. We tried very hard to provide some support to the community, and so we pivoted our experience to a pilot telemedicine project where our student volunteers were still in Guelph, and we scheduled telemedicine appointments, either using a video chat telemedicine platform, or for clients who didn't have any internet access, we could also utilize the same platform in making a phone call to the family. They walked through a sort of standardized parasite prevention questionnaire with the family, and we talked about risks and essentially came up with a recommendation about what parasite control products would be important for those families. Heartworm disease has been rampant in both communities with pretty high positivity rates over a many number of years, and we've through our work, seen those positive rates go down over time. And so we really didn't want to see any backslide in those experiences. So our telemedicine was very focused only on parasite prevention and modestly successful. We provided prescriptions to almost 200 pets over the course of 6 weeks in the spring. Including heartworm prevention. We partnered with local veterinary practices who were still seeing clients curbside for some families who needed to gain heartworm tests and those kinds of things. But for the large part, we managed pretty successfully to pull that whole project off. So that gave us a lot of experience using the telemedicine platform. And at the time when those clinics got canceled, The other thing that got canceled was our senior veterinary students who would normally be out in the field getting experience and working in various rotations all through the summer in also achieving additional experience. Their rotations also got canceled until August the 15th. And so at the time, being the everly optimistic pipe dreamer that I am, I thought, well, I could maybe try to make it up to both of those groups by planning to set aside 2 additional week-long rotations in the fall of this year, where students could accompany us and go into these 2 communities where we would sort of follow up on many of the vaccinations that we weren't able to provide in the springtime, deal with any other health-related matters, as well as for the first time, perform remote spay-neuter activities for the college. We've partnered with other providers who've been using or being able to do that service in the past, but OBC itself has not had the appropriate accreditation or equipment to do that. And so, you know, COVID has taught us all a lot of things. What it's taught me is to maybe rein things in a little bit and not be so optimistic that things are going to turn around very quickly. As the summer progressed and the fall has kind of unfolded, I really didn't know whether or not we were going to be able to continue to plan these 2 week-long experiences, 1 week in Kettle and Stony Point and 1 week in Walpole Island. And so I started to reach out to a number of colleagues, get some advice. Am I crazy to think about trying to continue to do this work? I reached out to Allison and to the community and to our colleague Brenda in Walpole Island. And, you know, what I heard was that the communities were, you know, pretty confident of the low risk in and around their communities at that point in time. Our students were very excited to continue to potentially be able to do this experience and understood that that might require some behavioral, you know, attention on their part to really bubble carefully prior to leaving to go into the communities, to think about how we might try to manage some of the risks involved with this. And so we've continued with our planning, modified a lot of the work that we are planning to do extensively, but provided there isn't any further outbreaks or any other last minute activities that prevent us from leaving, we'll be heading out to Kettle and Stony Point on November the 16th for a week, where we have about 35 surgeries and 45 to 50 wellness experiences planned for those students for the week. And so I wanted to just chat a little bit with people today. I'll kind of run through the rest of this quickly so that people have time for questions if they'd like. Essentially, in planning these activities, we really, you know, as I just sort of spoke about, saw the enormous benefit still of trying to provide some activity, and then thinking about what the risks involved were, and then trying to manage what those risks might be. And so we thought through, obviously, you know, the severe consequences of a COVID transmission to the community or to ourselves and to our reputation. And so our approach has really been to plan this activity to really try to minimize that risk as much as we possibly can. We've obviously had many volunteers involved, and in the past, unfortunately, given the risks involved in taking people from many different communities with different risk factors and bringing them all together at the same time, that isn't considered terribly wise. And so our OVC community is, to some degree, I guess we consider it sort of a tight little bubble, especially for the students who are in their final year and in clinics. They're kind of in the hospital with the same people a lot of the time every day. And as long as they're not doing a lot of socialization in other social networks outside of their daily student activities, then generally the risk should be quite low. So we've restricted our volunteer pool significantly, which means that we may not really be able to do as much as we might have wanted to, but we're at least going to go and get some things done on this trip. Our volunteers are all going to be tested for COVID prior to leaving, and we hope that our results will be arriving in a way that we can have the result before we get too far along in the week. Our other major shift or pivot has been to ensure that there's no client contact. So essentially prior to us leaving, so next Saturday, we have student volunteers who will be doing the telemedicine consultations with our families for both pre-surgery as well as wellness appointments. All of those consultations will be done using telemedicine prior to a departure, such that we'll have basically a pretty defined plan of what each patient will need from us. The clients will do drop-off and pick-up contact only with us. And we'll be very focused next Saturday on providing as much client education during that consult. And it's necessitated us sort of really beefing up how we would, normally talk to clients about a lot of things at the discharge. A lot of that will be now very extensive written discharge instructions. Of course, we'll be doing contactless payment through our telemedicine platform. In both communities, the clients have been quite used to a system where they would book their appointment at the local health center, and then there's a mechanism in place where they can drop cash safely to somebody at the health center, which then sits idle for a number of days, and we hope if it is infected, it becomes disinfected by the time it comes to us. We'll be doing daily screening of our volunteers, and our clients and families will all be screened the day before and at the time of drop-off to ensure that nobody has symptoms or anything as well. And I think we hope that this approach will keep everyone safe. One of the other things that we have really focused on is to say that members of the community will also have veto power right up until the last minute as we're packing up. Also OVC, if OVC perceives at any point right up until the point in time that we leave, if there's a concern or students themselves have concern, then for sure we will simply cancel and try to pivot to some other activity for the week. And all of us, both the community members and myself, are watching the COVID numbers pretty carefully in all of these different communities. And obviously, if anything changes this week, then we'll be sort of readjusting our approach to things. So those are kind of our thoughts. Those are the things that we've considered. I'm gonna open up the option here for questions at this point in time. And I'll just stop the share so that I can kind of watch the chat window and the Q&A session. So happy to take any additional questions if people have them.
Thank you so much, Dr. Bateman. #pivot indeed. So I don't see any questions in the Q&A. I'm just going to move over to the chat here. And quiet on the chat as well. Oh, nope, we've got something here. Are you able to see that, Dr. Bateman?
Yes.
Okay.
So let me just read through. So Allison has indicated, the community members have been waiting and wanting these services regardless of the COVID challenges, which I think speaks to the value and the importance of these kinds of partnerships. She's mentioned that the chief and council in Kettle and Stony Point were involved in helping to find the facility that we're going to be using and make this happen within the community. And again, she talks about where we were years ago, where none of the leadership within the community, although they may have been aware that these kinds of activities were happening, they didn't really pay a whole lot of attention to it. Whereas now there's a real engagement, and the community is, communicating to their leadership how important and valuable these services are, and that leadership is now being much more responsive, which is amazing. She also says the students are so valuable to us and do so much behind the scenes work to provide wellness clinics every year. And I would echo that. They are amazing. They're very important to me, knowing that they will one day become veterinarians who will work with an Indigenous community on their own. I fully supported hands-on training for the students to help in their learning and engagement with our communities. They are a driving force. They certainly are, and I can't even imagine what would be without it. And so it's through the OBC's Community Outreach Club that we've got the on-reserve services that we have today. And our entire group has been really instrumental in animal welfare and veterinary care advancement. So thank you. Thanks, Craig. I appreciate that comment as well. It's this is heart work, really. You put your heart and soul into making a difference in communities like this. And it's really great it will be very great to go back into the community and to see old friends and familiar faces. So thanks.
That's outstanding. Okay, there's actually another question here. With shift from oral to written communication at discharge, I'm curious and wondering to what extent literacy levels in the community amongst the populations you will be serving might be a barrier to following your recommendations for care.
Yeah, it's a great point. Our written communications are aimed at trying to provide a fair amount of pictorial illustrations of concerns, such that somebody who is having difficulty with literacy could potentially still understand some of that. And as well, our students will be doing the best they can to kind of cover some of this information as part of the telemedicine appointment. And we certainly encourage people to, ask questions and clarify anything that isn't clear for them. And our, when we do the handoff at the pickup, we do also have a phone line, so that if anyone does have care concerns following our discharge, that number will be available. It'll be manned by a vet tech for the week, who will certainly be in touch with us, and then we can follow up with anybody who has any concerns or questions. So a note from Esther, are there scholarships or supports for community members to become veterinarians or RVTs or future sustainability? And absolutely, Esther, that's one of the things that we're really focused on. One reason that I didn't really talk about at the beginning of this is that one additional reason I really wanted to try to get into these communities this fall was that we are planning our first sort of more northern remote outreach experience, a 2-week rotation next spring for our students into a community about 4 hours north of Thunder Bay. And so we really wanted to get a little bit of experience under our belt and make sure that all of our equipment is working properly and that our packing and organizational lists are serving us in good stead. And so that work in the spring is supported by PetSmart Charities of Canada, who very generously supported our goal of being able to provide that rotation. And one of the aspects of that funding is to support travel for 2 high school students from the community that we'll be working with to come to the University of Guelph to learn a little bit about what post-secondary education looks like, to spend some time with our students in the vet school, and to generally sort of learn about what a career in sciences or veterinary medicine might look like, and to discover the pretty important decolonization and support system that the University of Guelph is providing for Indigenous students to help make that transition from small remote communities to urban life in Southern Ontario. So yeah, we're definitely focused on that, and we hope that will expand, or those kinds of things will expand over time as well.
Thanks again, Dr. Bateman, for your time and the amazing information and your hard work too.
Thank you.
So we'll move on to the last topic of the afternoon, and it's about the adventures with the TAS SNP truck. And this will be presented by Dr. Hannah Booth as well as Dr. Esther Attard. Dr. Hannah Booth graduated from the Ontario Veterinary College in 2007 and has passionately pursued population control through spay and neuter ever since then. She spent a year volunteering with organizations throughout Central America, sterilizing shelter and street animals. Upon returning to Canada, she worked as a veterinarian at the Toronto Humane Society and then served on the board of THS. She manages the volunteer organization Toronto Street Cats and is a founding member of the Toronto Feral Cat Coalition. She currently works as a staff veterinarian for Toronto Animal Services, focusing on the mobile spay-neuter program SNP. She also serves on the OSMA board. And Dr. Esther Attard graduated from the OBC College in 1991. She started a career as an equine practitioner, operating an equine mobile practice and even her own small animal clinic, before deciding that shelter medicine and surgery was her passion. Dr. Attard has worked in animal shelters for over 20 years and appreciates the daily challenges and rewards. Currently, she's a chief veterinarian at the Toronto Animal Services, and her favorite things are her family, her wonderful husband, 2 lovely daughters, and a shelter dog, of course, horses, and traveling. She also serves on the OSMA board. And Dr. Attard will be fielding the questions for this session. And you're okay to go ahead, Dr. Booth. And Hannah, are you there? Are you hearing me? Dr. Booth?
Shalini, I don't think she's a panelist.
Ah, okay.
That might be why.
We will promote her.
She should be one now. I've promoted her a couple times. I think her internet must be kicking her out, but she should be. There she is.
Gotcha. And if any concerns with sharing, I can also do, oh, there we go. We're good. We're good, Hannah. Excellent.
Unmute.
I am. I think I hear you. Hi, we hear you now. You're good
Great.
to go.
Can you see me yet?
Sure can.
Okay, wonderful. So thanks so much. It's an honor to be presenting with all the wonderful folks that have gone before. We're going to spend the next 20 minutes talking about our mobile spay-neuter program and the community partnerships that have really made it a success, and how this program has allowed us to get out into the community. And then we'll also briefly discuss the modifications that we've put into place to restart in the COVID era. So if you aren't local or haven't heard of us, we are a municipally run animal services. We have 3 shelters, 2 of which have stationary clinics attached. And in 2016, we launched our mobile spay-neuter program, SNP, or Mabel as we have nicknamed her, which has really allowed us to get out in the communities and remove the barriers for accessible care. So our SNP truck is traveling into low-income communities. We're offering free spay-neuter services as well as wellness appointments for preventative care. For the majority of our clients, these are free services. So we do have a waived fee scale. So if folks are making less than 30,000 household income, they are offered these services for free. And this photo here is, I love it because this pup has such great wheels and a great bumper sticker. Stand up for our community. He was referred to us from one of our road officers after he got a muzzle order. And we saw him a number of times at our SNP truck. So this map is showing, in Toronto, we have designated neighborhood improvement areas, or previously known as priority neighborhoods. So we drive our truck into these neighborhoods and park at typically community centers, homeless shelters, Toronto community housing complexes. And if none of those are available, we were going to No Frills grocery stores, and they were wonderful in offering spacious, luxurious parking lots for us that were accessible to our clients and easily accessible for our truck to travel into. And for anybody who's thinking about starting a mobile program like this, I would say, really thinking about the size of your vehicle and where the neighborhoods that you need to access, making sure that, if you are in a very urban area, that you're somewhere where you can easily maneuver your vehicle and park in those areas. So I'm going to spend the next 2 slides talking about some of our community partnerships. So this first shot is our Pets for Life project at the Jane and Finch neighborhood. We were very fortunate to partnership with Humane Society International and received funding from PetSmart Charities of Canada to pilot Canada's first Pets for Life program that was modeled after the wonderful folks at HSUS, as we heard in Amanda's presentation earlier this morning. This has been a wonderful experience. We had the funding to be able to hire a coordinator to go out door to door, being in the community, and also oversee a group of volunteers that were also in the community. So this middle picture is, I took this shot of the owner tattooed like his cat at the Yonge Street Mission. So this is a partnership with the Community Veterinary Outreach Program. When the CVO holds their wellness clinics, we follow up holding a spay-neuter clinic at Yonge Street Mission the next week, so that we're able to offer that sterilization piece for any of the owners that need it. And the last photo here was taken outside 545 Lakeshore, which is one of the large city homeless shelters. So we have partnerships with most of the shelters in the city, both private and city run. And we typically have a representative social worker at these shelters to liaison with the residents, which makes it very easy to be able to book them and ensure that the clients show up for their appointments. So more partnerships continued. That first shot is of myself and the police outside of 200 Wellesley, which is one of the largest subsidized housing complexes in North America. And it was our regular stomping ground for the first 3 years that we were on the road. In this case, for this pup, the community police booked the appointment and brought him to the clinic in their cruiser. And the owner was so thankful, as he wasn't mobile and didn't have the means to get his dog there. So a lot of the partnerships that we have are with social workers, our road officers, community police, and it really makes the service a lot easier for us to offer because they are there to liaison with the clients and help with transportation and making sure that the pets show up for their appointments. So that middle shot there is of us outside Etobicoke Humane Society. They had helped us with a large hoarding case of cats. So it was an amazing opportunity to have the wheels to be able to just drive right to their shelter. The cats could spend a week kind of acclimatizing, and then we could drive right up and do that sterilization piece in a day. And it was amazing because their volunteers were able to help on the inside with the pre-med and the recovery. So it ran very smoothly, and just a huge asset to, to be mobile and to be able to get right to shelters that need your help. This last photo here is our truck at the Open Streets TO. So in the city of Toronto, they run a lot of city events. So Homeless Connect is another example. And it's because we are also city run, we try to make a presence at all of these events. And it's an amazing way to get out there and promote our services and make sure that the community knows that the services that we have available. So I'll just shift the focus here now and briefly talk about what has changed for us during COVID. As I'm sure that you all did in the first few months of COVID, we were shut down for the first 3 months. And then gradually we restarted with our TNR cats, our rescue partnerships, and some of the more urgent public appointments, pets that, multi-pet households where there was risk of breeding. We started those up, and it wasn't until September that we restarted our SNP program. And so we did it slowly and safely. We started in only a single neighborhood with about half of the appointments that we would typically book. We had a lot of new protocols and totally revamped communications. So clients were very aware of exactly what to expect on the day, very clear instructions as to their drop off and pickup. We were also quite worried about, how owners would handle the post-op care. So we made sure that we had online videos that we would make mandatory for them to watch ahead of time. So like many clinics, we moved to the curbside drop-off and pickup. They were staggered appointments every 10 minutes, so it did slow us down a lot. And then we were COVID screening at the time of booking, in our reminder calls, and then also at drop-off when they were dropping their animals off. So the changes that we have noticed most during COVID are, for us, communications have been a lot more difficult, having everything. Oh, sorry guys, are you still seeing my screen?
I'm seeing your desktop right now,
Okay.
Hannah. Oh, there it is. We're back.
Sorry, let me get back here.
Okay.
So the changes that we have noticed most are the difficulty with communications, a lot more time spent and a lot less, connection with the clients. Everything now is via phone and email, as opposed to previously we were doing large group intake and discharge. And our post-op instructions are all online now. In terms of like the engagement, the actual connection with the clients and the clients, the connection between clients and the community, we definitely see a big difference in just the amount of engagement and community feel. Previously at drop off and pickup, it was quite a lot of folks would be chatting and discussing their animals, and it was a really good opportunity for people to engage with others in the community. So our efficiency, we have decreased the number of bookings by about half and really drastically reduced our services. So previous to COVID, we were on the road about 4 days a week. Now we're 1 to 2 days a week. We were booking about 15 to 20 animals per clinic, and we were maxing it out during COVID at just 10 animals, trying to book those from animals of single, multi-pet households so that there weren't as many drop-offs. We previously had been traveling into about 24 different neighborhoods on a rotating basis. And post-COVID, we were only parking at Jane and Finch, primarily because it was close to where our truck resides, and also that was where our Pets for Life program had launched. So the most need was in that area. Previous to COVID, we were offering the wellness in addition to the spay-neuter. So usually at the end of our spay-neuter day, we would have 3 to 4 wellness appointments for vaccines and microchip. And we had to really concentrate just on sterilization services now. So we have stopped doing the wellness appointments. So this is just a quick slide to let you know about, we've had to change our VPCR protocols. So previously, pre-COVID, the vets were chatting with clients at check-in and after physical exam. So because of limited contact on clinic days now, we have to do these VPRs via the phone ahead of time. So it has been a bit difficult just because a lot of our clients are difficult to reach by phone or don't answer. So it is a bit time consuming to organize that, but on the plus side, it is great to do last minute reminders, for fasting animals, make sure that they've watched the post-op video and to be on time for their appointments. So generally our restart did go very well, and we attributed this to a few main things. So this video here I've included, or this photo I've included to show one of our amazing techs who post-COVID was not able to be on site, had to work remotely. So she has been at the base of all of our communications since we restarted. And that has been hugely helpful because she has such an intricate knowledge of how our clinics run and the patients to communicate well with our clients. And this is very thorough in all aspects of booking and organization. So she has been a huge help. And for anybody, looking to start one of these community programs, I would really advise to make sure that you find a superstar employee to head up your communications, somebody that has great people skills and the patience to treat clients very well. So also our clinic staff were super eager to get back to a job that they really loved. We were really eager to be back in the community and helping pets and clients. We were lucky that in Toronto, we didn't face any resistance to our strict protocols. Everybody wore their mask. They did as we told them, showed up when they were supposed to. So we were very lucky that everybody really adhered to all the protocols that we had set out. And just that we had, at the time that we opened, there was very limited risk. At the time, cases were less than 100 new cases in Ontario per day. So the risk was low, and with the protocols that we had put in place with limited direct contact with owners, a very, very fairly risk-free endeavor. So unfortunately, about a month post-opening, we did have to suspend our services again. That was primarily because the cases in Toronto were going up, and particularly in the Jane and Finch area where we were parking, it was became a hotspot of COVID in Toronto. So that, alongside with having quite limited staff, we only have 2 part-time surgeons and 2 full-time tech staffs with other techs rotating in. So given potential isolation protocols, if people were exposed, and keeping in mind that we really needed to prioritize our shelter animals, our TNR surgeries, and our partnership surgeries, we made the decision to suspend SNP services for now. And when case numbers go down and things are looking up, we're very eager to get back into the community again. So we're ready to take questions, and our director, Dr. Attard, is here to answer questions as well.
Okay, there are no questions yet. I'll just say for us too that it's been super frustrating because the Pets for Life program really helped us and really worked and helped to open up that community to us a lot more. And now it's just hard because of COVID that everything is sort of in isolation again. And that is just such a frustrating thing to have to work through. But we're hopeful that we will get back, and we're still doing stuff in our stationary clinics, but not able to do work on site where we have these communities that don't have access to transport and don't have access to care. And so just trying to figure out different ways to do things still as we move through the pandemic.
Thank you so much, Dr. Booth and Dr. Attard. Yeah, it's very interesting to have some insight into how an organization like yours is having to adjust to all these changes. Thanks so much again. And we've got a question from Allison Brissett. Okay. I'm just waiting for the question from Allison. In the meantime, for Allison's question, we've just posted in the chat box the link to the happy hour time. We thank everyone for staying till the end and hope you will join us there. There's some really great chat in the box that's happening with ideas and support for each other being offered. So Allison's question is, we have many feral colonies in our communities. Would TS consider partnering or assisting in our clinics after COVID?
Can you guys hear me?
Yes, we can.
Yeah. So because we're city run and we're a municipality, we are only allowed to assist with animals within the city of Toronto. So unfortunately, no. However, we are also part of the Toronto Feral Cat Coalition. And through that venue, we would be happy to have conversations and try to help in any way that we could.
So Hannah, I'm just going to add to that because I am going to explore it. I'm just thinking, today we had all these great presentations and met all these wonderful people doing all this wonderful work. And so I'm just sort of thinking that SNP is just sitting there right now. And so there may be ways to explore doing some things with the SNP truck in other communities. There may be ways to think and explore to do some more work with that. So Canna's right. We are a municipality and we just do things in Toronto, but there may be ways that we can offer something outside of Toronto during this time. Well, we'll just see. So we'll just have to, again, when you go to these conferences, it's always great because it just gets you thinking about different things that we may be able to do. So there may be a way forward with that. Let's see, is there another question?
Yes, one by Amber asking if were you able to continue to offer any wellness services such as flea, tick prevention, microchipping, etc. during the spay neuter appointments?
Hannah, do you want to take that one? You can answer that. We do.
So we, with every spay neuter appointment, included in that free service is the vaccination, the revolution treatment, and the microchip. We would do that if we were doing the spay neuter. However, we weren't able to continue just wellness appointments when we restarted in COVID, just because we were really trying to prioritize those animals that might be breeding and we had limited space. So not during COVID, but every other time, yes.
Yeah, and about the doing the flea treatment and the wellness appointments and that kind of stuff. Sorry, my dog is now barking. We found that that really opened the doors to SNP too. So that was part of the Pets for Life work that we did, and we did open up more wellness appointments, and we found that more people came and then went to spay neuter. So that was a really good way to get the buy-in and get the trust of the community.
Thank you so much again, Dr. Attard and Dr. Booth. I think I'm going to pass over to Dr. Stephanie Black right now for the wrapping up.
Hi, everyone. I don't really have much to add other than just to thank our sponsors again. Without all of our sponsors, today would have not been possible. So thank you so much to OBC Pet Trust, BCA Animal Hospitals, Hills Pet Foods, Food, Shelter, and Love Program, Benson Medical, Ogena Solutions, and Vet Purchasing. Thank you also to all of our amazing speakers that have left us all very motivated to help our community and those in need.